Stay unmuted when you're talking, or muted when you're talking.
Members, welcome to this, the first remote meeting of our Health and Community Committee. So I'm going to commence the meeting. You are hereby summoned to attend the remote meeting of the Health and Community Committee to be held on Thursday, the 11th of June 2020 at 4 p.m. In our chair, Alderman McKeon as chair of our committee. So I'll commence the meeting with the attendance. Alderman Devaney.
Here. Here.
Alderman McKeon.
Here, Karen.
Alderman Bork.
Here.
Councillor Barr.
Here, Karen.
Councillor Burke.
Apologies, Karen.
Councillor Duffy.
Sure.
Councillor Edwards. Councillor Farrell.
Here, Karen.
Councillor Ferguson. Councillor Ferguson.
Yep, I'm here.
Councillor Harkin.
Here.
Councillor Logue.
Sure, Karen.
Councillor McHugh.
Shaw, Karen.
Councillor Minnie.
Here, Karen.
And Councillor Riley. Okay, thank you, members.
Okay, folks, can everybody hear me? Hello, everybody hear me?
Andy, just wondering, did I get nominated in there as a 10? Didn't hear any answer.
Morris Devaney, yeah, we'll get you put on, Morris, okay? That okay?
That's okay, that's grand, perfect.
I'm just going to do the wee statement of remote meetings here, folks. I would like to remind everyone who is in the remote attendance that this meeting will be broadcast live via the Council's YouTube channel and will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. The broadcast may be terminated or suspended in accordance with Council protocol. Members and approved speakers are reminded to only have your mics and cameras on when speaking at the meeting, and to use the chat box to highlight if they want to speak. By participating in this meeting, you are consenting to being filmed, and the use of storage of these stories and images for broadcasting or training purposes, and the purpose of keeping historical records and making these records available to the public. A copy of the Council privacy notice may be available to be found on the Council's website, www.giantstrabane.com. Yeah. Okay, folks, so we're moving on then now to point 4, declaration of members' interests. Have any members of declaration of members' interests?
It's Martin Riley here, Chair. Can I just declare an interest in the sense that I work for the Alzheimer's Society? So we would have an interest in the care homes issue from an employment point of view. Thank you.
That's okay, Martin.
Chair, I just put it in the chat box there. I have a declare an interest in item 10, being a trustee of the Dolce Vita.
Okay, see that, Councillor Ferguson, that's okay. Anybody else before we move on? Okay, we're moving on to section 5, which is a deputation attendance by Dr. Bob Brown of the Western Trust and Dermot Parsons of RQIA. to do a presentation on care homes in Northern Ireland. Thank you.
Thank you very much, Chairman and members of the Derry and Strabane Council. I'm very grateful for the opportunity to speak with you all today and hopefully to take some questions. And I'm just conscious as my slides come up. I'm Bob Brown, as you can see, Executive Director of Nursing and Director of Primary Care and Older People Services. I've met many of you at the council office, and Chris Kearns just here beside me, and Chris is our communications manager, who has worked right beside me for really all of the COVID experience, and brings a lot of advice and support during this period. I should check, of course, that Dermot, who's also on the call, Dermot Parsons, who's the Interim Chief Executive of RQAA. Is Dermot content for me to speak first?
Certainly am, yes.
To all the councillors, if you're content with this, I have a number of slides, and I'll try to work through the presentation in, let's say, a maximum of 15 minutes. If you're content with that, then we'll be able to listen to yourselves, which is the more important part of the meeting, and endeavour to answer any questions you may have. And if I could ask for the next slide, please. Or do I change the slides? I don't think I can change the slides. Can't change the slides.
No.
What we'll do is, if there's any risk of a pause and losing some of your time, and if I can't change the slides myself, which I clearly can't.
Members, the minute secretary, Teresa, will change the slides for you. So Teresa, if you could pick that up, please. Thanks.
Okay. So if Teresa's able to change the next slide, then we can commence. While Teresa's doing that, I'll just first of all pay a tribute to all of our staff throughout the Western Trust for their huge effort during recent months. I've always been very proud of them in the 3 years that I've worked in the Trust, but it's been an exceptional period for us all, for you all, and grateful not only to staff for their tremendous professionalism and the quality of the care that they've provided to the people who live in our council area. Also grateful to yourselves for your support as councillors. There have been times when you've worked with us in a really positive way. Questions that you've brought on behalf of members of the community that people, particularly Chris, have responded to, and that partnership has been really crucial. So thank you for that, and I look forward to how we can develop that going forward. From my perspective as the executive nurse, but also of older people director, that's really crucial for us going forward. So it doesn't look like the slides are going to move through for us, and if it's possible, then I'll just keep going, so that we don't lose too much of your time. So what I would want to cover is how we have worked across our organisation to develop a prevention strategy for the COVID timeframe. So that is 2 slides forward. If you're able to go back one, that would be great. If not, that's perfect. Back one more. That's it. So we're now in time, and I'll just say next slide, please. So keep it at that one, please. So I want to tell you about how we've worked to prevent COVID from becoming a big issue in the care homes in the Western Trust area, and the weekly process that we've been involved in. I'll tell you about our current position with regard to outbreaks in care homes, the role of the care home support team, the data that we present, how we've worked with our QIA and indeed the Public Health Agency and the Health and Social Care Board. Dermot and I have been part of meetings 2 at least, or often 3 times per week, to oversee overall quality of care for people in care homes and in supported living. And then there's a piece of work that I'll just tell you about at the end, which is with regard to how do we keep care homes COVID free. The term keeping a home green or free of the illness is a term that's increasingly being used. So next slide, please. So our overarching aim since March has been to deliver a comprehensive prevention and management of COVID program of work. So we've focused on those 3 things: reducing the number of outbreaks, mitigating the risks, whether that is through support from nursing, medical, therapists, social care teams, straight into homes, and then developing resilience in the community. And that's something that we've certainly focused upon every day and made good progress, as you'll hear in a few minutes. So next slide, please. We have a weekly monitoring process whereby over 40 indicators are being reported to the Health and Social Care Board, and they include all aspects of the response that we've planned for and adjusted to in terms of the experience that care homes have found themselves in, and that has been a very collective effort between the 5 trusts plus the ambulance service, and we've used data very effectively to respond appropriately. So when you see our latest figures for yesterday, the 10th of June, and for the 2 days before that, so this information changes as you might expect every day. So to bring you the validated position, I'm going back a couple of days. So the overall position is one of amber, and that's based on the number of homes, and there are over 60 homes in the Western Trust between the independent sector and the residential statutory homes. There are 5 of them in this city area, and 4 of them here, and 1 of them in Limavady, 1 in Strabane, 3 in Derry. So they're part of that overall group of homes, and the status of amber is based on the number of homes that are in a COVID situation, which I'll tell you about in a few minutes, is at the present 10 homes. So our overall position is improving, and I'll be able to say to you how that position has changed over the last 2 months. But homes that are now COVID free, out of that, on Tuesday there were 68 homes, is 47, and that is an improving position from 47 last week to 53 this week, and there are a lower number of amber homes and a lower number of red homes, so that's good. The overall position across the region is one whereby outbreaks in care homes is improving all the time, and the data that the care homes provide directly to the RQIA through an app is how we are monitoring the position on a day-to-day basis. The trust also, we look at homes from a safeguarding perspective, as well as the incidents that they're reporting, and homes that have had failure to comply notices with the RQIA are part of our overall rating. So the bottom of that slide is just showing that we have expanded beyond how the region is rating a home green, amber or red. So we take into consideration their safeguarding history, the incidents they report, and their failure to comply notices to create an overall rating. But it's I will say a very sound position overall. So next slide, please. So back in March, when the region was preparing for the COVID outbreaks to pick up at a significant pace, we were planning for the potential for 90% of homes across the region to be in an outbreak situation. and that would of course have been in a worst case scenario. There's 438 homes in Northern Ireland, private and statutory run, and if 90% of them had been in an outbreak situation, that would have been a huge challenge for the region. And we know that people of older age, and indeed those with a disability, are a higher risk because of the level of vulnerability they carry, and therefore a care home outbreak would be one of the most difficult and for those residents and indeed family members, challenging positions for them to have been in. And I'll say a wee bit more about how we've responded. So next slide, please. We know, or we knew certainly in March, that planning for a higher mortality was likely in the care home population, and we also knew that those residents who were at a higher level of risk, their clinical acuity or indeed the level of disease would be higher, and also we were preparing for up to 50% or even higher staff absence. Next slide, please. So the 9th was on Tuesday, and looking at that slide, there's an indication of 10 homes in the Western Trust being in an outbreak situation. So that's 10 out of 37, 52, 66, 76. So 10 homes out of 76 on Tuesday, outbreaks in the Western Trust. Next slide, please. And we have a very small but very effective care home support team of experienced community nurses, and they are the single point of contact for every care home in the Western Trust, and they coordinate the support for personal protective equipment. They advise on the response to outbreaks, and they ensure that infection control measures are fulfilled. They work closely with the PHA and the RQA care home support team, which Dermot will tell us about, and there's been a very strong collegial partnership approach. So any care home that gets into difficulty has a single point of contact to the care home support team, and also we've had Zoom calls every Tuesday to all of the care homes for really 2 months now, and also to the supported living providers as well. Next slide, please. We have a daily risk review, so across a whole series of indicators, we are able to monitor every home. For example, the number of patients who, or should say residents who are symptomatic. We can monitor the number of residents who have been admitted to hospital in the last 24 hours, and any deaths. We do the same for staff in terms of number of symptomatic staff, number who have been tested of residents and staff, and a range of other indicators such as the care homes tell us if they have enough PPE, if they need support with staffing, if there are particular issues around provision of medications or environmental cleaning. So there's a very good range of indicators that's all on a dashboard, and there's a daily report through our own trust and through to the region, which the department collate on those sorts of information. So next slide, please. Based on the position that we see every day in every home, we're able to adjust our response. So the care home support team, with district nursing and GP input when necessary, and indeed there's been good use of technology. Some of our consultant geriatricians, for example, have been able to provide virtual support to homes, and also the acute care home team in the northern sector of the trust have reached into homes whenever there have been residents who have had difficult symptoms, whether COVID or non-COVID. One of the challenges of COVID-19 has been that some people have very clear symptoms, such as a persistent cough or a temperature. Others have had unusual symptoms, and some have had no symptoms, and that's for all ages of the population. It just adds to the challenge. But as of Tuesday, there are 9 care homes that we've been working directly with, and I have some information, too much for a slide, but basically what it indicates is for any one of those homes which is in an amber or in one case a red status, we ensure that we follow the policy whereby every resident and every staff member is tested for COVID, We check the position on their staffing rota, their accessibility to PPE, the care that individual residents may or may not need, and as I mentioned earlier, support with cleaning, as well as any care delivery challenges that they might have. And we also would carry out either a virtual or an in-person face-to-face visit, and we either send in our own support team to undertake swabs, or we provide them with kit, and there's a regional approach to be able to do that on a wider scale, whereby in time every resident in a care home will avail of a COVID-19 test. So next slide, please. This is an indication of what the regional dashboard was saying on Tuesday. So across all of Northern Ireland, nearly 11,000 staff had been COVID tested. So that's about a third. There are around about 30,000 staff working in care homes, and then the number of beds is around 16,000 beds across all of Northern Ireland, and we can see that 8,000 residents have been tested. So yeah, about 62%, and you can see how the number of people who across Northern Ireland are tested positive. So it's a low number overall, but I think from the media coverage nationally and internationally, there can be false negative tests, and there can be people who have a negative test and then a positive test. So we much prefer to look at the symptoms, and that's why the relationship with the care homes is absolutely crucial. There were no deaths across the region on Tuesday, and then the number of occupied beds was just short of 13,000. Where you see that beds are not available, there are quite a number of homes that would have challenged with isolating residents due to their environmental conditions, and also some homes, and including in the Western Trust, have double room facilities for maybe a husband and wife. So that can prove a challenge, and why there would be quite a number of rooms, or beds I should say, unavailable, and a very good positive position across the region. And Dermot can say more about this in terms of self-rating for PPE and cleaning and so forth. So next slide, please. Our summary across our 68 homes that completed the app data on Tuesday. 1,800 beds occupied, around 130 beds vacant that are unusable due to the reasons I've said, 184 that are vacant, but could be used, and they're the ones that we would want to clearly facilitate people to move from hospital, but we would do that in a very risk assessed way. Next slide, please. And the data, and just at the bottom here, I think there's 3 slides in a row. It would be important for councillors to be aware that this data is based on self-reporting from the care homes themselves through the regional app, and so there's further validation of this information taken both by RQA and the department, but also by ourselves, where we compare and contrast with other information, and we directly ask the providers themselves. So on Tuesday, there had been no new resident cases in the previous 24 hours in the Western Trust area. There were 3 residents who are symptomatic, so clearly that's really positive news. There are 809 residents who have been tested. The number who tested positive in the last 24 hours were 24. And the total number of residents affected, so 171. The reason we don't say that the total number who have tested positive is that that's information that requires further validation, and we tend to look at the total number who have been affected or who have carried and been living with the symptoms of COVID-19 or indeed flu-like illness. 3 people hospitalized in the last 24 hours on Tuesday, and sadly 1 person had died during that 24-hour period. Next slide, please. Number of staff cases in the last 24 hours, the number who are symptomatic, 3, number of staff tested to date over 1,000, and you can see those figures right down the line. 223 staff, Western Trust care homes, have been affected by COVID-19. Next slide, please. So 66 of those homes told us they were in a very favourable position regarding their workforce, both in terms of the number of skill mix of staff as well as the training and readiness and for COVID situations. The two that are amber and we'll work directly with in terms of that could be training support, or it could be there are two homes that are having a difficulty with the number of registered nurses or care assistants, and we would put some support in to help them to ensure that their rota is safely staffed. All the homes are in a good position for PPE and other equipment, and 2 out of the 68 are saying they're amber, and they're really for the same reasons as mentioned above. Next slide, please. So 9, according to the regional data determined by the RQA Care Home app, were in an outbreak situation. The reason why I reported 10 earlier was the PHA, the duty room have a report which is slightly ahead of the RQA app, and as a home would have, for example, a deep clean exercise undertaken, once they're 14 days with no symptomatic residents, then they're out of the outbreak and went from 10 to 9. Aerosol generating procedures, is number of residents is 7. That is people who are maybe wearing an oxygen face mask or having a higher level of ventilation support, and they've been at higher risk, or if they were COVID, the staff could be at higher risk, or indeed other residents. So you can just see some numbers there that give you an indication of the types of people who are maybe at higher level of risk in our care homes on Tuesday. Next slide, please. I think we're down to the last few slides. It's quite interesting just to see the number of days that homes across that group of 68 have been without any cases of COVID-19, or indeed people who have COVID symptoms. So there's a big group there of 27. There's been no days. In other words, there's still people who have some symptoms or positive cases who are hopefully now recovered well. But there are also a steady increase in the number of homes who are getting to, first of all, 10, then 20, up to, in one case, they haven't had, one home has had nobody symptomatic for a year of a COVID or even a flu-like illness type symptom, which is fairly remarkable. But it's to try to shift that and to get to the point where the number 27 gets less and less and less. So next slide, please. This last part of the presentation, just to give councillors an indication of a piece of work that the region is very interested in, and it's how do we enable care homes to stay green or COVID free. Now that's a difficult subject area. I mentioned earlier that there are challenges with the types of symptoms people have. Also, some homes would have staff who move between homes, such as the bigger groups, and that is something we've discouraged. And also the fact that the challenge between people moving from hospital back to their own care home, or trying to prevent people moving to hospital in the first place if they get ill, it all plays into this subject area of keeping homes green. So our ambition is to develop some key principles, such as how you staff a home to keep it COVID free, how best to ensure sound environmental cleanliness support in a timely way as well. So next slide, please. That's a proposal that's in development. So these bullet points give an indication of some of the actions that we will be continuing to develop into a programme of work. So really strong infection prevention control measures, additional training for staff, clarity on the wider symptoms of COVID-19 so residents can be observed closely. So we have a wellness checker. We have that risk assessment whereby care staff and nursing staff in care homes should now be testing temperatures of residents, checking using the wellness checker for any risks every day, even twice a day, working with our care home support team and the PHA, linking in with the GPs. So the GP remains the responsible practitioner for every resident in a care home, and we continue to have a really good partnership with GPs, and some good examples where they have worked with ourselves. We established a COVID community rapid response team a month ago, and that's a team of district nurses who are supported by therapists, social care, and others when necessary to in-reach directly in a rapid response way to a care home. And we've used virtual working to connect staff in care homes with ourselves, which is working quite effectively too. And we've supplemented at times staffing into homes, but I'm pleased to say not as much as we might have been thinking 2 months ago was going to be the case. And some other parts of the region have had to put their own trust staff into care homes much more than we have had to. And you may want to ask a bit more when we finish the presentation. But just to say, any decision regarding admissions into care homes has to be undertaken in a very risk-assessed way. And I imagine councillors will also be interested in the subject of visiting into care homes, and we continue to follow the regional policy that there should be no visiting, but that's currently under review, and again it requires a risk assessment for every resident really in their home, but mindful of family situations. Next slide, please. That's it. Thank you very much for listening. Not quite the 15 minutes, but lots that I could say, and maybe sometime would talk about domiciliary care, but very grateful for your time, and I hope I can follow through with answering your questions. If not, Chris and I will note them, and we will come back to you, and we have, of course, the electronic briefings and other ways of communicating directly with you. Thank you.
Thank you very much, Bob. For a very detailed presentation, a lot of information, some positive information. I think we're living in very, very strange times, difficult times, and 30 years of NHS, being an NHS worker, is the most difficult times ever I've experienced, and strange. I have 6 speakers here looking to come in. Does the 6 speakers want to hear the presentation from Dermot, or do they want to ask the questions now? And the first speaker would be Sean Harkin. Sean, do you want, Councillor Harkin, do you want to ask your question, or do you want to get the presentation from Dermot and then ask your question when all the presentations complete?
Well, I would be happy to go with whatever you want to do, Chair, and whatever the consensus is. I'd be happy to hear Dermot's report as well too.
I'm just thinking in the interests of the 2 gentlemen that's doing the presentation, if they could, be complete, then we would have the fuller picture, and rather than having to come back in again and ask an additional question, we could get all the questions in the one go. If everybody's happy with that, I'm happy enough for Dermot to do his presentation now as well.
Happy to wait, Chair.
Thank you. Okay, Dermot, thank you. Are you there, Dermot?
Sorry, we've been using a different app all through this. Can I start by thanking you, Chair, councillors, for being prepared to hear from us today. And I suppose before saying anything, I really do want to acknowledge the fine work that has been done by staff teams during this crisis. The co-working with trust colleagues that Bob has described from different organisations has been great, and the fine work done by staff in the nursing homes and the residential homes across the jurisdiction has been absolutely fantastic. And I mean, and you could see in Bob's figures there, staff have also been impacted by this terrible condition, and the impact it has had on residents and families who've been unable to visit, and staff has been really major, and that's the context that we're talking in. So if we could just move on to the next slide. I suppose really the normal role of RQAA, regulation including inspection predominantly, challenging poor practices, working with services often to promote improvements in care quality where possible in ways that causes little disruption to people who live in the homes themselves, and safeguarding rights and then reporting back on findings, whether it's findings about individual homes or about services across the piece. So if we could move to the next slide. Essentially, our role, I wouldn't say it changed entirely in that we retained most of our statutory functions during this time, but we were tasked to do some different things during this time. I suppose Bob was talking about the time back in the start of March when we first became aware of the challenge of COVID-19. And I suppose as a regulator, we were very aware by, well, certainly by the middle of March, the stories that were coming out of other European countries about services that were almost abandoned and people found themselves neglected. And we were really determined that services in Northern Ireland should not operate that way. On the 20th of March, we were issued with a direction by the Department of Health from the Chief Medical Officer, who's responsible for RQIA. And we were basically directed to not carry out the regular routine inspections of care homes, which would be carried out twice a year, but only to investigate where there were highlighted areas of risk. And those words on the screen were words that were used in that direction. And part of the underlying thinking around that was to make sure that we operated in accordance with the guidance about visits to care homes in the same way as, both people's families and other professionals who were directed not to go in unless it was essential. And I suppose the illustration for that for us is if we are doing our normal inspection program, an inspector will go to 2 homes in each week. So during a 14-day incubation period for COVID-19, we could be in 4 homes, which clearly isn't a good idea if we're trying to minimize footfall and reduce the risk of infection. So if we could move on to the next slide, please. Now, Sean Holland, the Chief Social Worker, tasked us, I think he wrote to us, I think it's about the 23rd or 23rd of March, basically tasking us to set up a support team for services. And the idea here was we should deploy our staff instead of going out on inspections to ensure essentially that homes were as prepared as they could be for the pressures that were likely to come during the pandemic. Now, some of the preparedness was around ensuring that the vast volume of guidance that was issued during this time would be understood and that services knew how to work and practice in accordance with the new guidance that was issued. I think during this period, Bob, you may have a different count, but I think we think there's been somewhere between 170 and 180 pieces of guidance issued regionally to services during this time. Many of them multi-page documents, often going to homes that are individual standalone homes, sometimes updating on previous guidance. And there was a lot of work undertaken to ensure that basically homes were as prepared as possible. And in the early days in particular, that people were familiar with how to engage with supplies for, largely things like PPE, where the existing supply arrangements just didn't work particularly well. So we've been channeling out the guidance documents on behalf of the other statutory bodies and engaging with services to make sure that they really knew how to prepare for managing both the management of COVID-19 cases and so that practices in homes were as safe as possible to reduce the risk of contagion in homes. And now, it's not directly related to the work of RQIA, but we know from engaging with other regulators that of the care homes in this jurisdiction, somewhere around 35% of the care homes have had an outbreak to date. This contrasts with in excess of 40% in England and in excess of 60% in Scotland. So there really is something, despite the terrible nature of this situation, about how well services have worked in this jurisdiction. So next slide, please. between the 23rd of March and now, essentially we've had about 4,000 contacts with the services across Northern Ireland. And these are not contacts in the way of sort of a quick wee call to see how people are doing. The vast majority of these contacts are either services contacting us, seeking guidance and working through issues with us that often then led to us engaging with trust colleagues or colleagues from the Public Health Agency or from another statutory body. Also points where we have gone out and proactively contacted services when we have had a sense that there might be a problem in a particular area of practice during that time, and often leading to us then engaging back with statutory bodies, sometimes about achieving greater clarity in guidance issued and making sure there was a consistent regional understanding so things were as safe as possible. A huge range of issues have been discussed during that time with providers, but I suppose the really big ticket ones were in the first probably half of the period between mid-March to date. Big issues were PPE around where do we get it, and also really how do we use it? Have we got the right PPE? Have we understood the guidance correctly? Challenges around coping with staffing levels that were under pressure, difficulties with, I suppose the point that Bob was making about ensuring that people used as consistent a staff team as possible. So looking for much less sort of mobile usage of agency staff and things like that than would usually be the case, and particularly measures around infection prevention and control, but both in homes where there was not an infection, around supporting practice in terms of enhancing practice to try and reduce the risk of the infection getting into the home. And also, linking in with another point Bob made, supporting homes in understanding how they could best ensure that people were, as far as possible, isolated within the places where they lived to prevent further infection spreading around a home once the infection was there. More recently, the discussion has been around concerned around medicines management that we think is broadly settling now. Continued queries around testing, some of it around availability of testing or when people should access testing, some of it around rights issues around capacity and consent, and how testing should be administered for people who do not have the capacity to consent to a test. And I suppose right through the time, concerns around visiting, usually for people visiting family members rather than any other visitors. Through this really difficult time, families and residents, patients have obviously been traumatized by the challenges in being able to see and talk to their relatives, maybe when quite distressing things are happening in the place where they live. Now, Bob had talked about the regional app, and I suppose the regional app and Bob were sort of, we've had a struggle with the regional app between probably all organisations. At the start of this pandemic, there was a reporting arrangement through to the Public Health Agency, and each trust was separately gathering information about, I suppose, the current state of play in the care homes in their area. Over time, we developed a sort of an app, as Bob was describing it, which has gathered comprehensive information about self-reporting information about the status of residents in the home, the status of staff, and how the home was coping with a number of the pressures that it's been facing. I think that app, I think you would agree, Bob, after a struggle getting it in place, I think it's reduced the burden of reporting for services who are busy doing other things, just managing the situation in the middle of the crisis. And it's also been helpful both at trust and regional level in terms of understanding what is actually happening during the course of the pandemic and identifying services that were particularly under pressure. And for us, because we set up, as I say, this service support team consisting basically of all our inspectors and our senior staff and management team, it also helped services flag up to us when they were needing help so we could contact them back and determine what challenges they were having with that time. Now, we were still tasked with carrying out inspections where risk was identified for people. And I suppose during particularly the early part of the pandemic period, this was a particular problem because with the ceasing of visitors and with care management arrangements being impacted and the professional footfall into homes being cut, frankly, we were receiving a lot less information from the sector about homes where there were risks and we should be inspecting. That's actually picked up a bit, probably since from the end of April onwards, that's picked up. And we have now started to receive a fair amount of intelligence from the sector again about homes where there might be concerns about practice. And if we could have the next slide, please. So, I mean, along with the other health and social care regulators across UK and Ireland, I mean, our statutory inspection activity has reduced just to minimise the risk of spreading infection. We have followed up in situations of concern, and I mean, since the start of April, we've done 32 inspections on site in response to identified risk, and I think very nearly all of those inspections have been in homes where there has been an outbreak. And we've taken enforcement action in 4 of those services to address specific concerns. And to be clear, we wouldn't do that lightly. Part of the guidance there was from the department in mid-March was that we should support really the taking of pragmatic decisions by services under pressure. So the letter of the regulations and the standards has not been upheld in situations where that's been impossible. But I mean, where, for example, we've found situations where people have just not used the PPE that was available safely and people have been left at risk, yes, we have taken enforcement action and will continue to do so. Now, I suppose just looking at how the information that we've gathered during this time, we have been very aware of services where there are outbreaks, of course. The information that we've gathered through the app still needs a fair degree of validation. I mean, to explain Bob's point about that, this is a new tool that was put in place to gather information just in recent weeks. There is still quite a high level of people making wrong entries in it. So it's not perfect, and the data does have to be sort of cleaned by ourselves, by colleagues at the department, by people in the trust to understand it. But we can now see that the number of homes where there is an outbreak or a suspected outbreak has dropped very significantly from what it was at the peak. We can see that, and I mean, I hope you don't think I'm being insensitive about it, but we get reports from care homes every time a person in a home dies. They must report that to us within a period of generally 24 hours. Now, they don't report to us the reason or the cause for the death because it's often before that's certified, but that's a long-standing arrangement. We can see now that the number of deaths that are currently occurring in care homes is still higher than it was in 2019, but it's nowhere near the level in excess of where it was in 2019 a few weeks ago. We can also see that there are some, what we would see as sort of characteristics that are particularly prevalent in homes where there have been outbreaks. And in a nutshell, they tend to be more prevalent in homes that are larger, more prevalent in homes that are located in an urban place, and definitely more prevalent in homes that are nursing homes rather than residential care homes. And that's probably because the people are more likely to have underlying health conditions. When we can't be sure of that, that's probably it. We also know, and this isn't something we expected, that there's no link between homes where we've had sort of adverse inspection findings and an outbreak. And there's no link between homes that have had enforcement and there being an outbreak. So we can see that of the homes where there's been an outbreak to date, only 10% of them are homes where there's been enforcement action in the last 3 years. And we've actually just recently, just the end of last week, we were talking to colleagues in the Care Inspectorate in Scotland who capture information in a fairly similar way to ourselves. Their findings are broadly similar, and we're working with them to try and understand these figures better. Reason being, we believe there's a need to think about preparedness in case there's a further sort of upswing in COVID-19 later in the year. And we're looking to see how we can use the information that's been gathered during this phase to try and help homes prepare better against the risks from any future upswing in COVID-19. Next slide, please. Looking ahead, we're still in the phase now where there clearly is sort of ongoing community transmission, albeit a lower level of COVID-19. And we need to find ways in which we can get back into regulating and considering, if you like, the normal kind of risks that prevail in social care settings that are not directly related to COVID-19 in any way. And we need to do that don't, again, continue to not increase risk of moving infection from one place to another. We also, like other organisations, have staff who, for their own personal circumstances, are not able to visit care services at the moment because of conditions they have themselves. So some of the approaches to inspection we're developing feature us sort of being there, obviously using PPE, protecting the well-being of people in a service and our own staff. Some of them are looking at how we can gather information remotely, how we can use technology to carry out some types of inspections, and we're looking at what other regulators are doing about that. And obviously, I mean, the direction that we got from the department to reduce our statutory inspection programme back in March, circumstances are moving and changing, and we're engaging with the department to basically see when it's going to be reviewed to allow us to get back into inspections as we would often do. I mean, continued partnership with health and social care to support bodies to support the regional response. It hasn't occurred yet in the Western Trust area, but we approached the department about whether we could send inspectors into homes to work alongside the teams in homes to help sort of embed their knowledge and understanding in particular areas such as things like infection prevention and control. The department agreed we could do that and issued a direction to allow us to do that, which is quite different from what RQA normally does. And we've done that, I think, in about 15 homes to date with their agreement. And there's still a potential for us to continue to do that in the time ahead as we hopefully get back to some sort of regulation approach as well. Okay, that's me finished with my slides.
Thank you very much, Dermot, for that detailed account. Folks, I have 9 people looking to speak. So the Bob and Dermot will hopefully be able to answer all the questions. I would just encourage everybody, obviously, as there's 9, so everybody gets their point in, that we be as brief and as accurate and as mindful of time as possible. The first councillor I have is Councillor Sean Harkin. Go ahead, Sean.
Thanks, Chair, and thanks, Bob, and thanks, Dermot, for your reports. Thanks for coming today. I know you are very busy. And I also want to thank all the workers in the health service and all the workers who are in the private care homes as well, who have been magnificent from the beginning of the crisis, the pandemic, and well before that, obviously, and will continue to play that essential role. Just for Bob and for Dermot, the reason why you're here today is because obviously there has been great concern about what's been happening in the care homes. I'm sure people have seen the front page of the Irish News today with the news that, well, the confirmation really that the trusts were directed to send patients into care homes, even if they had the virus. So that's going to be one of my questions about how many homes did that happen to in the Derry and Strabane area? But I also would like to hear your opinion about that, if you think that this was made sense. And obviously there has been, you know, a lot of criticism about how the private care homes have functioned through the crisis. And just for your knowledge, and for really anybody that's watching the meeting, the council just last week, or in the last couple of weeks, off the back of that crisis, has voted to call for the private care homes to be returned to the health service. Such is the scale of and the level of concern about what's happened in the private homes. So my first question is, I think I read a report from the Western Trust saying that they had distributed in the region of 335,000 pieces of PPE to care homes. And if I could get confirmation that that's true, that would be very useful, because that's a lot of PPE, and that was a number of weeks ago. So I would imagine it could be more now, and I have some questions about that. Will that's provided by the Western Trust? Will the private care homes, the owners, be required to pay for that PPE as any other company would, who would be in receipt of it? Now, we've seen desperate situations here, earlier on in the pandemic, where at nursing care homes in our area, people were dropping off PPE provided by the local community. And the question has to be asked, why weren't the private owners required to pay for that PPE themselves? So that's one question. Well, how many pieces of equipment? What was the cost of the health service to the trust? And will this be repaid? The second one is, Bob mentioned this about the workers from the health service who were sent into the care homes. How many workers, how many hours worked, what homes, and how much cost to the trust? And will this be repaid to the health service by private owners, as it would be expected in any other business? The third one is, Minister Swan announced that there would be a package of support for the care homes of 11.7 million. And I think we all welcome the news that that care homes will be supported, and that workers will be supported, and that residents will be supported, and that and so on. But I think that again, given that these are private care homes, I think there are questions we need to scrutinise. So this is going to be more money handed directly to private care homes. And so my question is, how is this going to work? Are we just going to write them checks and then hope that they pay it out in sick pay to workers? How is that money going to be monitored? And is the Western Trusts, well, I would imagine you will play a role in monitoring how this money will be spent. And again, this is public money. It's really a bailout of the private home sector. So that's another question about that. And then the last question is, this is one for Dermot directly. So my understanding was that the RQIA didn't carry out a single inspection between March 20th and April 30th of this year. This is in the middle of the pandemic, and that the RQIA only began to carry out inspections after a judicial review and after media criticism. And so can we get some insight as to what was happening there? Thank you.
Thank you, Councillor Harkin. I take that to be 4 questions. The first 3 is Bob's, and the last one is Dermot's. Am I correct in that, Councillor Harkin? Yes, okay. Yeah, if you're ready to answer, Bob, that's okay.
Yeah. Thank you, Sean. I've written these down, and I'll do my very best to answer where possible. You mentioned the direction that the trust had been directed to send people back to care homes who had the virus, you said, and that's definitely not the case. And I haven't read what you're referring to in one of the local newspapers, but maybe I will later. We've always worked on the basis that every person who's transferring from a hospital to a care home will have a COVID-19 test first. There should be a communication of the results to the care home. A person should be isolated on return to the care home for the 14-day period and their symptoms monitored. And indeed, at the end of my presentation, when I talked about keeping green homes green, it was about trying to provide alternatives to bringing a person back to a care home where possible. But of course, that sits in the overall flow of a system which is challenged given the number of people who are moving about between community and hospital. How many pieces of kit? So you did quite accurately refer to the 300,000. That was up to a point in May. The number that I can tell you now is just short of 700,000 items of PPE from the 20th of March really right through to the current. About 80%, Sean, of PPE that we've utilised has been into the community, and I can say that it's always been on the basis of partnership. So care home providers had a responsibility at the beginning. They still do to acquire PPE for their staff. But that's been a huge topic area, as you know, in terms of accessibility. And we've just worked on the basis of support where it's needed. And clearly that has been a successful support and something that we've done in care homes and in supported living. What's the cost of all of that? Overall, regionally, a number of millions. Will we be trying to get that back from the care home sector? It's not a question for me to answer. It's more for the board and the department. But this has been an unprecedented experience for us all, and the most important thing was to work on the basis of safety for residents. And like yourself, I'd want to pay tribute to the staff in the care homes who, from a managers right down to those who are supporting with environmental cleaning and all of the caring staff, their whole attitude to this experience has been fantastic, exemplary really, and they've worked really closely with us, and I'm very grateful for that. So Sean, the last question regarding the package, that some of that's paid directly to care homes for equipment, and some of it's paid for us, such as for syringe drivers, to ensure care homes have equipment. But in terms of staffing costs and sickness, as you mentioned, that'll be administered directly between the department, the board, and the care homes themselves, and so the trust will not intervene. However, as you know, and I know in previous times that you've asked us questions, the contract that we have with the care homes will be one way in which we will assess and continually review how that happens in terms of, for example, their staffing notice. So I think I've answered your questions. Thank you.
Okay, Dermot, are you ready to come in?
Okay. Yes, I am. Okay. Now you'll appreciate if there's a legal process underway. I mean, obviously we can't discuss that. And I mean, I can say there has not been a judicial review hearing to date. There is a judicial review listed for later this month. There is in the period of time you talk about, we actually did 6 inspections during that time, and we've done another 26 since. And the number is low, yes, because during that time was the time, I suppose, when we were receiving the least information about concerns in care homes. And when I'm saying concerns in care homes, I do not mean about there being care homes where there is a COVID-19 infection, because frankly, if there is a COVID-19 infection going on and it's being well managed, there is not a perceived benefit from carrying out an inspection. But during that time, we were probably getting the bulk of the calls from providers, and we're frankly probably struggling at some points dealing with nearly 100 calls and contacts a day from homes in the sector receiving support and guidance from us. as I say, we are now receiving more information from the sector, the pattern of our inspections, which on the basis of the instruction from the Chief Medical Officer or on the basis of there being risk present, are really mandated by us being made aware of risks in the sector for us to go out and inspect. And we'll continue to work on that basis until the department directs us differently.
Okay. Okay, Councillor Harkin. I'm going to move on to Councillor Riley, if everybody's happy with that. Councillor Riley, are you ready for your question?
Yes, thanks, Chair, and good luck to you in your year ahead, and also to your Vice Chair. Thanks to Bob and to his colleague, and also thanks to Dermot for the lengthy presentations and for giving them to us in advance so we could have a look through them earlier today before the meeting started. I suppose a couple of questions for Bob first in relation to the report that you had, Bob, showed that the 68 homes are now green. But I suppose my question is, how long did it take them to get to green? Because part of the issue has been outlined by Councillor Harkin is that in the care home sector, there were a lot of issues about PPE. There were a lot of issues about the fact that people in the care homes were not having the same level of testing. So I think that there was lessons to be learned there in terms of how quickly care homes had an issue and how quickly they were addressed. So while it's good news that you're able to show that they're now at the green marker, a little bit more clarity on how long it took to get them to green would be appreciated. Within that presentation, you also touched on page 5 about the residents of care homes who have other illnesses. I'm thinking specifically of those who may have dementia, and the connectivity between the people who provide care to citizens with dementia and the loss of their visitors and their daily routine. How can the Trust work to try and deal with those issues? And also in relation to the discharge from the COVID hospital setting back into the care home. Obviously, pre-COVID, there was issues about how people were in hospital and not getting discharged out into the community. How did the Trust see that being dealt with going forward, because it still remains an issue for people being discharged from one setting to another. I'm conscious that the Minister earlier this week did launch the new strategic framework, and I'm wondering, in terms of care homes specifically, how much thought has been given to both two issues in terms of the strategic framework for care homes going forward. One being the impact of immigration changes to the recruitment of people who work in care homes, and secondly, the rate of pay for those working in care homes, because there are two key issues that need to be addressed in any strategic forward planning for the care home sector. In relation to Dermot, thanks again for your presentation. Councillor Harkin touched on the question I was going to ask in relation to the frequency of the inspections, which obviously for safety reasons have been reduced to reduce infection transmission, but in absence of being able to physically get feet on the ground to go and visit, have you used better IT connections to try and continue some level of inspection, but doing it in a way that is best use of technology to try and fulfill that function, but doing it without any risk of transmission? Thanks, Chair, for the time to ask the questions.
Thank you, Councillor Riley. And Bob, if you're ready to go first with the response, thank you.
Thank you, Councillor Riley. So Martin, in your 4 areas, I've noted how quickly did those homes get to green. So yeah, the position changes every day, and as I look, it was 63 homes in green, 5 in amber, and 0 in red yesterday, and so it's a fluctuating picture, and as indicators change, we respond appropriately. So to answer your question, the getting to green took a number of weeks. Some homes have always been in a green situation across all the indicators, but really from the beginning of April, there's been a very variable picture, but a gradual and positive increase in the number of homes that have been in an amber situation. Through the numbers who have been in a red situation, which has thankfully been much smaller than would have been predicted, and those who have managed to stay green or got to green. So very variable, but I would say that the situation can change very quickly in any home, and thus the importance of us continuing to work together. You asked a very interesting question about people who are residents in care homes or indeed supported living who have other illnesses. Could be a mental health problem that they've had all their lives, or dementia that they've got in older age. And we have been thinking very carefully about how to advise and support care homes with what you rightly called the daily routine. And we've been utilising our in-reach visits, our telephone contacts, liaising directly between, for example, care managers and their review calls on the phone with residents and with staff, just to check on those sorts of things. The loss of a loss of visitors is hugely significant, a very distressing situation for I'm sure most families, if not all, during the last 2 to 3 months. The policy is the right one, and it is being reviewed, but we have to continue to aim to reduce the movement of people in and out the front door. But there are exceptions, and will always be exceptions whereby, for example, in an end of life situation, or if you mentioned a person living with dementia, sometimes they can be so distressed that the only person, I heard an example, if they're just seeing somebody through a window, it can make them more distressed. So we've been able to advise and support care homes to, by exception, allow a visitor to be with a person when it really proves important. And the overall review of the visiting policy is something that the whole region needs to, as we are doing, review very carefully. The care homes pre and post outbreak, in terms of flow and transfers back into those homes, it's always been a challenge for us. You notice the slide that there's over 1,000 beds available, but we have to protect not only the people who are in the home through testing and bringing people back in a very risk assessed, careful way, but also, Martin, we have to make sure that we don't keep people in an acute hospital for an inappropriate period of time where they can become deconditioned and are at risk of getting infection and falls. So it's a very careful balance. And as has been the case in domiciliary care, some families have been keen to bring people home, provide the domiciliary care themselves with our support. And that's, I think, is something in terms of the strategic framework we'll want to think of more and more. How do we as a trust help families? This is Carers Week, as you probably all know. How do we help families and informal and formal carers to work together to help people to be safe in their own home? And finally, on the strategic framework, immigration is really important, and we depend on those cross-border relationships and the flow of movement. And whilst it's a department priority to address, as a trust, we would want to ensure that enables us to continue to have a workforce that is supported and valued in terms of their movement. And your final point on the rate of pay, it is a big topic area, and through our own work, we would want to continue to support career development for people who work in care homes, and that's perhaps one way of ensuring that they can be valued and paid at a higher rate if we can work with the providers to give them a career pathway that enables them to continue to learn and to develop. Thank you.
Thank you, Bob. Are you ready for the question, Dermot?
Yeah. Yes, I mean, absolutely. The frequency of inspections was reduced hugely during this current period for all the safety reasons that you allude to. Now, I suppose during that time there are some controls in place. As I was describing to your colleague, we've had a lot of very lengthy engagements with our homes, talking to managers, talking to staff. We've also had contacts from representatives of trade unions and other groups linked to homes during that time, giving us information that we can consider and decide how we're going to respond to. It hasn't been possible always to respond with an inspection during that time, but we have also linked in with trust colleagues and the different trusts. And I mean, where we've had significant concerns about the safety of practice, we have inspected even at the height of the pandemic. Now I think we're probably more at the point that you're describing, where we're looking at how we can use different types of technology to inspect more widely and sort of almost get a virtual footfall in the home where possible. And we're developing an approach in that, which we're hoping we're going to be able to share with the sector within the next couple of weeks. I think the approach we take initially will not be the only approach we're taking, because some of it's quite technology reliant, and some of it is, I suppose, us working hard to use the information that we receive that we can hold to develop very much more focused lines of inquiry that we can follow up going into homes using these virtual approaches, much more focused and looking at particular areas than we're able to do face to face. Now we actually last week we did inspections in 2 children's homes that way. We've also inspected adult services that way. And there's one situation where inspecting remotely actually also has led us to the point of potentially taking enforcement action with a provider, so we can see that it is giving us a reasonable degree of scrutiny. Not the same as going on site, but in this circumstance, it's the best we can do.
Thank you very much.
Thank you, Bob, and thank you, Dermot.
Thank you very much, folks. The next person is Councillor Rachel Ferguson. Go ahead, Rachel.
Thank you, Chair, and good luck in your year ahead as Chair. Thank you to both Bob, Chris and Dermot for the presentation. I'll not keep you very long, and apologies if you think I have 10 elephants upstairs. It's the only way I can keep little ones quiet. So, Bob, I'm just want to go back to, it was very noisy with the line there. You were saying that there's 9 care homes amber and 1 red. If you could just elaborate more on the difference between the amber and red for me, just to kind of figure out what the difference are with them. Also, the hot topic is confirmed cases going back into care homes. I know you want to keep green homes green. Do those care homes have a say in that? Because obviously you were saying you can't keep residents in hospital for 14 days to isolate them, and obviously, so just elaborate a wee bit more on that for me, if you don't mind. Again, I want to echo the same words as the previous councillors. You know, thanks to all the staff in the Care Homes Trust, you know, all the key workers. He's been working really, really hard before this, never mind during this pandemic. It's been really, really tough. Dermot, a bit of a app geek, so I want to just ask a few questions around the RQI app. Is there like mandatory they have to put that in, that details in, you know, because you're obviously relying very much so on that care home to be as open and honest as possible, and if they aren't completing that and for other reasons, is that taken as a risk factor to them maybe follow up on that? And then you were saying your new rules were more towards supporting the care homes, and kind of would that possibly be aligned with your new technology, as you've been able to go on and offer that support to learn how to use this new technology going forward? But as I say, really, really quick, and thank you very much.
Okay, Bob, if you're okay to go first, that'd be great. Thank you.
Sure. And thank you, Councillor Ferguson. So Rachel, amber and red. The position yesterday was 63 green, 5 amber, and 0 red. And using the definition of an outbreak, 2 or more residents or members of staff in a care home who have symptoms of COVID and then are tested and proven positive. That's an outbreak situation. And then I mentioned a whole set of indicators, which include the number of people who are symptomatic in a home, the number of people who are tested positive, both residents and staff, and then across other domains such as the resilience of the workforce, i.e. the percentage of staff who are off sick, the number of residents who have more acute illness, the number who are admitted to hospital, their ability to provide personal protective equipment, and there are many more. So what we're doing is a home that has any of those that are at an amber. So two ambers means the home is overall amber, despite a whole group of those that could also be green, and the same applies to reds. And then I mentioned earlier in the presentation, we also take a look across indicators that include their incident reporting, as well as their previous position regarding failure to comply notices. So it's getting a sense of the overall culture of a home and the quality of services that are provided over time. So that, I hope, answers your question regarding how we interpret the data. And then you asked about residents having a say in terms of the pathway back from hospital, or indeed if it's a person who's in their own home who now needs to be in a care home. That period of isolation from the point where they have a COVID-19 test, we would absolutely, when a person is well and able to make a decision about where they should be, we would include them in that discussion, and indeed their family members. And there are different scenarios that can happen. So a person may stay in hospital a bit longer on the basis that either the bed isn't available for them, or the isolation facility in their own room might be a risk, such as if the home is in an outbreak. And sometimes we would maybe transfer a person into a step-down facility such as Waterside Hospital, and we're also using Rectory Field for a similar type of COVID recovery type pathway. And I know other trusts, we haven't had to do this, but other trusts are using other kind of step-down facilities for a person to isolate for a period before they go back to their own home. So like a green isolation facility with a non-COVID situation. But it's a very challenging picture, but we absolutely would want to have family and patient resident involvement in that discussion. Thank you.
Thank you, Bob. And Dermot, your question around the app. You're ready to come in. Thank you.
Yeah, the app has been a really interesting experience because there hasn't been a time before when people have been mandated to do a daily return about anything, certainly not to RQIA. And I mean, I suppose there was a sort of rapid build in terms of the percentage of people responding. And I mean, Bob and I would have had dialogue earlier in this sort of situation where response levels were not high. The response levels are now each day somewhere between about 96 and 99%. It's not always the same handful that don't respond now. And it appears to us that compliance levels are good. And that was certainly helped by the fact that Sean Holland, the Chief Social Worker, wrote out to all providers and instructed them to do it as being a compulsory step. And it's also certainly been helped by the fact that both our admin support team and colleagues in the trusts were phoning round and still continue to phone around the homes that don't give us a timely response, because this data is really important to understand what's happening regionally, so that sort of responses can be planned and we can understand what's happening in the homes. I mean, in terms of the support approach, it's quite interesting. I think the public perception of RQIA is that we're a sort of punitive group who go around catching people out and applying penalties. In our title, the Regulation and Quality Improvement Authority should be the key, that actually we're meant to be about improving the quality of services, and certainly approaches to improving quality should not and cannot all be punitive. And we have seen that through the supportive approaches we've taken during this time, there have been real improvements in practice in a number of settings where people were perhaps not particularly well informed in the first place. I mean, going forward, it is important to us to work in a way that encourages good practice and encourages development and learning and growth in services rather than just taking punitive actions. And you will see that, I mean, during this awful time, there is learning in ways of working that have emerged during this time, and they need not all be just stood down when this crisis ends. So yes, I'm sure there will be alignment with new technology to support quality improvement.
Thank you, Dermot. And okay, Councillor Ferguson, are you happy enough to move on?
Yep, that's perfect. Thank you both very much.
Okay, Councillor Raymond Barr has indicated that a question has already been asked. So if you need to come on, Raymond, just speak. I'll let you in. The next person I have is Councillor Sandra Duffy. Okay, Sandra.
Yep, thank you, Chair. And could I also wish you all the very best for the year ahead?
Thank you.
I'd like to thank Dermot and Bob for the very detailed presentations today. They were very clear and easy to follow. I would also like to pay particular thanks to Chris in terms of the communication that he has sent out to us over the last number of weeks. So good to put a face to him. Just in terms of what other people have said, I obviously want to commend the work of our frontline workers and the frontline workers within the care homes. But I suppose, Bob, in terms of yourself, I know that the work, it would have been a very difficult period for yourself in terms of leading all this. So I would like to pay thanks to you as well for that. Now, in terms of the presentations, I do welcome a lot of the positivity in the presentation, particularly around the green statuses of many of our care homes now. So that is very positive news. In the presentation, you did highlight that it was identified at a very early stage that this was a very vulnerable group in terms of the people who were residing within care homes. I probably think that we should have enacted a ring of steel around our care homes at a much earlier stage. We had a strategy in place around protect the NHS, but it was protect the hospital. And the focus was more on the hospital, and I think that may have left our care homes exposed. So I just wanted to comment on that. I think that going forward, you know, if we are expecting a second wave, I think that we need to be looking at that and having that ring of steel around the most vulnerable group within our society that is affected by COVID. So I just wanted to comment on that. Many of the questions that I have been covered in terms of the access to PPE, how that was an issue at a very early stage, then in terms of people being released from hospital without being tested, and that was an issue at an early stage. There's two questions that I have that I know you sort of touched on it, Bob, already in terms of staffing, and it's just around any concerns that you have around going forward, and thankfully we didn't get into the situation here, but I know that I think in the Belfast Trust there was a situation arose and staff had to be deployed from the trust into the care homes. I know you touched on it with one of Sean Harkin's questions, but it's just in terms of going forward and the plans for the future around it and the learning around it and the redeployment of trust staff into the homes. How is that going to work, and is there going to be a robust plan in place so that we're not left in a situation that if there is a second wave, that we're in danger of not having adequate staffing levels for our care homes? The second question that I have is around medical treatment of residents within the homes. Was any of the decision making around the medical treatment, did that change in any way during the COVID period? You know, were people within the homes taken to hospital if they needed to go to hospital? Because I know that some of these concerns were raised with me over the course of the period of time. So just in terms of that, was the decision making at all affected by what was happening, and did people receive the medical intervention that they needed at that time? So that's probably two of the main questions. Just one other question in terms of the presentation, Bob, was around there's 7 care homes that haven't reported. Do we follow up on that? Do we get that information, or you know, can homes just choose not to send in the information in relation to their status? And then just finally for RQIA, not a question, but because everything has been covered, but just happy to hear that we are moving towards a situation where we will be moving to more general inspections as well in terms of standards within our care homes, because we know we had issues before COVID. So we want to ensure that standards are still being maintained within our care homes for this very vulnerable group. Thank you for the presentations as well.
Thank you, Councillor Duffy. If you're okay, Bob, go ahead.
Thank you, Councillor Duffy and Sandra. I mean, I'll answer your last question first, and Dermot will definitely want to expand on it. We do follow up with the care homes who if they don't respond through the self-report every day, every Tuesday when we have that Zoom call, we remind them of the importance of that, and the RQA are doing the same. So we're seeing every day the total percentage of homes that complete their data return, and we can speak with them individually because it's in their best interest to do that. And Dermot will maybe say a bit more. Going back to the start of your points there. You make a very good point about the vulnerability of the group and the ring of steel, and it is true to say there is some useful learning for should there be a second surge, which there's every chance that there will be in the autumn, and it will be important to build on the learning from this first surge. We absolutely acted quickly, and we were learning from what was happening internationally. I think you're accurate in saying that hospitals probably got a lot of the early attention, but care homes working with us, and indeed the providers themselves, acted quickly, and a number of them had, for example, closed to visiting in the middle to latter period of March, and the city and Derry itself as a city has got a lot of plaudits for acting very quickly from around about St. Patrick's Day. So I think there's been some very good learning for future, but mainly at a positive level. But that kind of ring of steel we need to be mindful of, as you say, for future. Staffing concerns. It is a big challenge in the West. And our ability to staff our hospitals and our community teams and working with the care homes is difficult. And from a nursing perspective, we're pleased that the intake to Magee has been increasing each year. And what we've got to do is retain as many local nurses, and also, as I mentioned earlier, develop pathways for a more attractive caring assistant role careers in care homes. We know it is often a younger person who begins a career in a care home, and we want to support them to help them to develop that career. And we will, Sandra, have to work very closely to develop a robust staffing model for all areas of the health and social care sector going forward, and the Minister's programme around the rebuild framework absolutely must ensure that the workforce is a key building block for that. Medical treatment was your final point regarding decision making. I can say with confidence that when a person in a care home was ill and required a transfer of hospital, I should say, that was always, as far as I understand it, given the due consideration that it should be. GP is the responsible practitioner for every care home resident. So if a care home contacted the GP and indeed the ambulance service, a swift decision when a person was ill enough should have been taken. And I see no reason to believe that wasn't the case. And of course, our care home support team overseeing support to homes, being aware of how illness is in a home, whether a COVID or a non-COVID illness, we're able to support and advise as is appropriate. And that's something was important before COVID and will always be going forward. But we will continue to work in partnership around that decision-making process. So final thing I would say is that there's a wellness indicator that we're beginning to utilise across all care homes, that's working in partnership membership. We can use that to assess a resident at any point in time, working with GPs to hopefully keep people well, but whenever they begin to become less well, responding appropriately, and ideally enable them with treatment to stay in their own home rather than come to an emergency department. Thank you.
Thank you, Bob. And Dermot, do you want to come in?
I suppose just reinforces Bob's point. When there's low levels of reporting from services on the app, yeah, I mean, the trust are following them up and we're following them up as well. And I suppose just the observation that was made at the end, yes, we know it's important to get out there inspecting again. We also need to hear from family members and people who are involved with care homes. If they have concerns about care as it's currently being provided, please contact us. We're really keen to hear information of concerns about quality of care, and we will respond when there are situations of risk.
Okay, thank you, Dermot. Happy enough? Councillor Duffy?
Yes, thank you very much.
Okay. Now, the next person is Councillor Stephen Edwards. Stephen, can I just extend a welcome to you to the Health Committee? I have never met you in person yet. You've been co-opted into the Derg area, my own area, or our own area, and looking forward to meeting you, and just extend a welcome to you, and come on ahead now with your question. Thank you.
Thank you very much, Chair, and I just want to extend my warm wishes to you as Chair over the next year, and I too look forward to working with you across the Derg area. There's many issues we want to cover. I would just first like to extend my thanks to all of our health and social care staff from across the Trust area. They've been doing a fantastic job, and especially those in our care homes and our nursing homes who have been facing intolerable conditions recently. I'm going to keep my question brief as for Dr. Brown. Go back to slide 18. I see that it is a proposal for new admissions and for transfers into care homes, that there will be safeguards in place, including testing and including the isolation for 14 days. It is a concern, having engaged with some care homes in Strabane, that they have been doing all they can to stop outbreaks of infection in local care homes. And then the Trust is sending in residents from, for example, Derry or further afield who could risk an outbreak on those trusts. So my question is that a proposal that's going to be implemented soon? Has it already been implemented? And is there any evidence of in the past that people have been transferred from other areas and it has caused an outbreak? That's my question, Chair. Thank you.
Okay, Bob, if you're at it.
Yes, thank you, Chair, and thank you, Councillor Edwards. Yeah, see, you pick up on slide 18. It absolutely is a proposal at this stage, Stephen. The evidence base is still very limited for holding a person up either in a hospital or in an alternative place. So let's say they've been in a medical ward in Altnagelvin and they live in Greenfield residential home or Melmot Manor. The proposal is that when they're recovered medically, they wouldn't go straight back to the care home. They would be isolated in an alternative place. The challenge would be two things. Is there clear evidence that 14-day period in another place will keep them safer and keep the residents in the home safer? We just don't know. The ability to understand that is to keep testing it. And the second thing is we're keeping people away from their home, and if they can isolated effectively in their own room with the right support, and they've had their COVID test beforehand and could be tested again with their temperature checked every day, that may well be the best approach to take. And the last thing I would say in response to your question is that there is a piece of work which has also been proposed around safe homes, and it's a bit like Councillor Duffy's question around how do we maintain a home to nearly like have a ring of steel around it whereby the staff live in the home. And there was some international evidence from Korea which showed that 90% of homes stayed COVID free if the staff lived in the home, and they tested that for a period of weeks. Now that brings both an opportunity and huge challenges, and the majority of our homes just could not facilitate that. But that is another thing that the department would like to have tested, but it met with quite a bit of resistance, both from trade unions, for very understandable reasons, such as it would need to be a voluntary approach to living in for staff, plus terms and conditions, and also the actual living conditions for them. But that would be probably the best way of all of testing, an appropriate way to keep a home green. Stephen, thank you.
Thank you, Dr. Brown.
Okay, thank you. Thank you very much. The next, Alderman Devaney, are you ready to come in?
Thank you, Chair, for allowing me in here, and I wish you all the best in the year ahead in your new role as Chair, and I look forward to working with you. And can I just take this opportunity to welcome Bob and Dermot here for a very detailed presentation. And I know this has been an issue that has been of great concern over the last while. But first of all, I would like to, like everyone else, pay tribute to the staff that have worked tirelessly and very professional since this pandemic has started back in March, and just commend the work that they have done. And I know it has been very, very challenging times. And yes, it has been a stressful time for staff, but it also has been a stressful time for residents and for those families who have loved ones in homes. And when we look back as this pandemic started to unfold, I think the crisis was, and the complaints were, lack of PPE and lack of testing. And I think that was a very, very vital question to be asked at the time, because although at the moment we seem to be in a very positive mode of how things are going, the deaths to COVID-19 have been down to zero there for a couple of days. I think they've been one in the last day, which has to be welcome. But I would agree with some of the rest of the speakers that yes, when this started to unfold, the hospitals seemed to got more protection, and I would agree with the rest of the speakers that care homes were left more vulnerable. And it's very, very hard to ask questions at this stage because a lot of the questions have been answered. The other thing that I do agree with the worry is that those homes that don't have the app or not reporting back in, I think it should be mandatory that those homes are made get that information back in, just in case something is going wrong. And I hope nothing is going wrong. And I think as somebody said, we would hope that nothing goes wrong. But in the times ahead that we look at, would we be happy now? And look, as I say, we're in a very positive mode at the minute. If the second wave was to come here, I would believe that we're in a far better position than we would have been back in, say, end of March, beginning of April. Are we in a position now, if it was the second phase was to come back, that see for testing and PPE equipment, that we're 100% sure that we have the volumes there to deal with the pandemic? Thank you, Chair, for allowing me in.
And thank you, Alderman Devaney. And if you're ready to answer, Bob, go ahead.
Sure. Yes. Thank you, Councillor Devaney. And we're certainly more confident than we were in March time. And there's been a very proactive day-by-day, week-by-week assessment of PPE for all areas, community teams, hospitals, and indeed care homes and supported living and other areas. And the flow of PPE is becoming, in the last month really, much more successful for the right kit to the right areas. And there has been a number of updates to the guidance, which at times has been a challenge, given, for example, the types of masks. There's been a variation at times. However, I'm feeling very confident that the right range of PPE is available when needed. I mentioned that we've provided just short of 700,000 items of PPE earlier, and we will continue to support that as much as possible. And I'm hopeful, Councillor Devaney, going forward, that should there be a second surge, the whole region will have learned from some of those early challenges that we had in March. And I mean, I think it is representative of the partnership that we have with the care homes, to build on this foundation of working together to know early when they're having issues, and they are telling us whenever they run low on masks and so forth. And I'm grateful to them for that, and we will continue to build on that effective relationship communication. Thank you.
Thank you, Bob. Happy enough with the answer, Alderman Devaney?
Chair.
Okay, thank you very much. Next person is Councillor Anne McCluskey. Anne, are you ready with your question?
Hi, I am indeed. Just like to echo what other people have said about to thank Bob and Dermot for the presentation and for their incredible work during this. My views on the privatisation of the NHS and my views on the government and the higher echelons of NHS management and their handling of this crisis are again very much in the public domain. I think we've ended up with the worst possible outcome. And the fact that half of our fatalities were in the nursing home sector is quite incredible. I worked in the NHS in 2003 during the last coronavirus outbreak, and we had PPE, we had rooms and storerooms full of equipment that we didn't ever require to be used. And the fact that they were left scrabbling around looking and asking people to make PPE was shocking. But my question is directly to Bob, and I wanted to ask him, I mean, we know that hospitals, empty hospitals, were decanting ill patients who may or may not, because nobody tested them, have been infected into the care home sector. And we also know that, or at least the impression is that there were DNR certificates which were used quite widely in cases that may not always have been appropriate, where hospital care would in fact have saved lives. And we look at, you'll be maybe aware of the paper published in the British Medical Journal, I think about 10 days or a fortnight ago, showing now that only 1/3 of the excess mortality, and this refers to figures in England and Wales, only 1/3 of the excess mortality is actually related to COVID, and that the rest is due to the lockup and the lack of the NHS operating as it should do. I'm just looking in today's Irish News, there was a man who died because of lack of lung cancer treatment, a pillar of his community and a chair of Eden Dork GAA. And these are stories, we're seeing people in out of hours now who are critically ill, who have not been given GP appointments, have not been assessed. I saw a 15-year-old who was almost dead this week with a very complicated medical condition that hadn't been recognised. So I'm wondering, the question is first of all about DNR certificates and their use, and the excess deaths from people who should otherwise have been transferred into hospital. I think they're two very important questions that may need a public inquiry to sort out. But so be grateful just for your comments on it. And thank you, Andy, for letting me in. Thank you.
Thank you. Councillor McCluskey. Okay, Bob, if you're ready to answer. Thank you.
Thank you, Chair. Thank you, Councillor McCluskey. Yeah, a really difficult topic area, but from my experience from the beginning of March right through to now, we were certainly not emptying our hospitals in any way with people who would be at risk of COVID spread into a care home. Everyone since the policy changed in mid-April was tested before they transferred into any community facility, and was followed up through our InReach team and so forth. And of course, in those early days, in the middle to late part of March, there was that period when we were all understanding the nature of symptoms. And as I mentioned earlier on the presentation, Anne, there was quite a variation of asymptomatic, different unusual symptoms, and people with common symptoms, and how people move across the system between hospital and community was something that we we took very seriously and continue to monitor very carefully. On your 2 points around DNA CPR, there has been some national media coverage on and for councillors' awareness. This is an acronym for Do Not Attempt Cardiopulmonary Resuscitation. So a person in a collapse situation and in anybody's personal life, there is an opportunity around anticipated and advanced planning, and older people can avail of that, whereby they are in a position where they can advise that in the event that they take ill, that there can be a DNA CPR within their record, and their GP, again as their responsible practitioner, should have an awareness of that, and there should be a signatory for that. I have no evidence that people were forced to sign a DNA CPR either in hospital or care homes, and we've had a medical and nursing ethics committee in place throughout COVID-19 established to look at this very important subject area with GPs on that committee. And I appreciate that there has been some national coverage, but not in the Western Trust area. To the best of my knowledge, has anybody been in that position where they felt compelled to undertake a DNA CPR notice? And then on your point around mortality, and it is quite a stark statistic that you refer to. I haven't read it myself. You say a third of excess deaths are not related to COVID, and your point is really around
2/3.
Pardon? 2/3. Yeah. So
Up to 2/3.
Yeah, so your point is, I interpret your point on was there such a focus on COVID that people were not getting access to other treatments, and there's been coverage on the national news around cancer treatments and so forth. There's no doubt that a significant number of services were reduced, indeed stood down by all health and care organisations during that those 2.5 month period, and that's what the reset rebuild process has a responsibility to do. I can't comment on data for the Western Trust. It may become available, but whenever patients don't have access to some of the pathways that were available to them pre-COVID, it would be understandable that some people would get into difficulty, maybe have an increased risk of illness, and there would have been, in some cases, unfortunately, people will have died earlier than they might have, and I've seen some of that data on a national scale as well, but it's not an easy question to draw a firm conclusion on without a much stronger evidence base on.
Okay.
Thank you very much. Thank you very much for that answer.
Okay, and thank you. Councillor Farrell has indicated that his question has been answered. The next person I have here, and I believe it may well be also his first time to Health Committee. If it is, and I'm right in saying that, you're very welcome, Councillor Mooney, and go ahead with your question.
Sure does. Thank you very much, Chair, and all the best for the year ahead, and look forward to working with you. And I'd like to thank Dr. Brown and Dermot for coming in and taking time with their busy schedule. This question is really directed towards Dr. Brown. Well, it's really just one question, and it's more out of concern that undoubtedly it's been a very tough time for care home workers and the staff in those care homes. Probably more or less the emotional toll of the whole scenario of COVID-19. And I would expect probably that morale would have taken a severe dent during this sort of situation. And really my question is, because of this, what measures has the Trust put in place to support care home staff to maybe aid in trying to alleviate any problems with low morale and any associated problems like recruitment and retention of staff? Because unfortunately it's been a very tough time for them. So that's really my question. I look forward to hearing from you.
Okay, Councillor Mooney, thank you. And if you're ready to answer, Bob, go ahead.
Thank you, Chair, and thank you, Councillor Mooney. That's an important topic. And in our weekly Zoom calls with care homes, they have talked about morale, and some of them have put it in their daily app return that morale's good or less good, and they've talked about some of the issues that have impacted on staff morale, such as an increase in sickness absence, or they because they are so close to residents over, in many cases, a number of years, and indeed family members, staff who have paid tribute to earlier will have been missing relatives of family members that they know very well, and that sort of thing can have an impact on morale. And you mentioned recruitment and retention and what impact this will have going forward. I would first want to say that the care home managers who have worked with us have been fantastic overall. Their communication has been highly effective. They've raised issues with us, and we have done our best to support in as timely and effective a way as possible. And where they have had difficulties with workforce and things that can impact on morale, I think our relationship has been strong, and they've told us that they've felt that they've had access to an open door for support, and what we have tried to do is ensure that where they have staffing challenges, we can support them in a number of ways. I'm thankful that we haven't had to put, and right back at the start, Councillor Harkin asked about the number of staff that we have had to put in to support homes. It has been a small number overall, in terms of comparison with some of the other parts of the region, and indeed nationally. But when we have had to do that, I believe, because we've had feedback that has helped morale, and also we have through GPs having very good connections with care homes, and at times, for example, undertaking FaceTime calls with residents, connecting with staff, our district nurses doing the same, also making phone calls through care managers to inquire, and those are the basics of what our teams every day. But that I think that helps on the basis that a home could very easily feel that it's on its own, and I would be disappointed if homes in the Western Trust felt that they were out on a limb, and that the Trust and local people were not doing their best to support them in those early weeks. There were lots of questions about PPE and direct support and timeliness, and we learned from that and acted as quickly as possible. And I'm pleased that April through May into June, that is now much stronger. I think, Sean, looking forward, the points that were made earlier around recruitment and retention and how we develop a resilient, supported workforce and an attractive place to work in care homes is a big challenge, and one that we can work on in partnership with local council to develop career pathways that make working in a care home a really good way to develop a career. Thank you.
That's great. Thanks very much, Nick, Bob. I really appreciate the answer now. Thank you. Thank you, Chair.
Thank you, Councillor Mooney. The next person, I see Councillor Harkin wants to make a follow-up point. The last speaker on the matter is Councillor McCann, and then once Councillor McCann gets his answer, Councillor Harkin, I would ask you to make your comment as brief as can, because we're approaching 2 hours on the thing here, and we have to try and keep the thing moving along. Thank you very much. Come on ahead, Councillor McCann.
Thanks very much indeed for letting me in. I wanted to ask a couple of follow-up questions to what Councillor Harkin had expressed earlier. If I've saved him some time and due, that will be fine. I want to say first that with regard to do not resuscitate documents, I know that in the very recent past, people in care homes in this jurisdiction have been asked to sign DNR agreements, and on one occasion at least, a person not yet 70 that was asked this, and had it not been that members of that person's family had been present and had intervened and said, "What the hell are you doing?" Good. It may well have been that this person would have signed the document. We need to be, perhaps we'll bring this up again sort of in another place, but there's something distinctly worrying about a couple of incidents which I have discovered in the last a couple of weeks, and I have no reason to believe that they're isolated incidents. Now, what I'm also very concerned about the information which has come forward about the way in which private care homes, and some of these, as we know, sort of are small, not big businesses, but small privately owned care homes. Some of them also are part of huge conglomerations of care homes and are not short of money, certainly not short of resources. Now, my question is this. Is there a list anywhere, and can we be told just how much equipment, PPE, for example, has been given to private care homes by the public service? How much grants and direct subsidy over the past year, say, has been given to private care homes? And is there any estimation anywhere or any itemization of the value of equipment supplied by the public service to care homes, and for example, how much money in terms of wages to representatives of the has been paid to private homes? And is there somewhere a total of this? And can we see that? And can we see where this money went? More importantly, as importantly at least, let me ask the question of what arrangements are in place to replace this money being paid by from the public purse to private interests. Is there a formula for recovering this money? Or is it done sort of on an ad hoc basis? Is there any record of how much of this money has been recovered? I mean, for the public service? Is there a paper trail? Since public money is involved here, I'm assuming that there are documents laying this out. And I would dearly love to see it, and I think an awful lot of other people, including other councillors, would like to see this in black and white. Thanks very much.
Councillor McCann, if you're okay to answer, Bob, go ahead.
Thank you, Chair, and thank you, Councillor McCann. I'm disappointed to hear that you have personal experience that people in some of our care homes in the Western Trust area have been asked to sign DNA CPR forms, and Chris or I would be more than happy to discuss that at a later point, because as a minimum it requires exploration and discussion directly with those affected and the care home provider, and also if you think that's not an isolated incident, all the more reason. So willing to pick that up, Eamon. It should always be a decision taken in a partnership between a resident, when they've got the mental capacity and abilities to make that decision for themselves, with their family, with the responsible practitioner and GP, and involving the trust and the care manager of the resident together. So that's the first thing, and that should always be the case. You make some really important points that I can't directly answer regarding equipment provision, grants, itemization. That there definitely is an audit trail for all of that information. There's no doubt about that. Your point around private providers, and is the audit trail robust enough? I interpret from your question to ask about how the public purse has been spent during these last 3 months. When some of these, using your example, homes should be in a better position, perhaps themselves, to have been ready for this. I wouldn't have any facts and figures, but the audit trail of information is something that could be given due consideration at a later date. Absolutely.
Thank you, Bob. Councillor McCann, you have our Councillor Harkin, you have someone up to make. Just if you go ahead, if you're ready.
Thanks, Chair. It wasn't really a summing up. Look, this has been a very, very calm meeting from the point of view of councillors, because, as everybody knows, there's been a lot of anger about the situation in care homes, and things have eased a wee bit now, which is very, very good. But look, I watched the Spotlight show as well. I'm sure everybody else did. I mean, there are workers blowing whistles. There are residents very frustrated, and the reason why I wanted to ask Dermot a follow-up question about inspections is because, you know, it seems to me not enough inspections were carried out at the height of the virus, right? And this is one of the things that people are very frustrated about, that it was reported in care homes that their workers didn't have PPE. It was also reported that staff were run off their feet because there wasn't enough workers there to deal with what a very, very difficult situation. So I think you said that there was 6 in that period. I says there was none. You says there was 6, but my understanding as well that most of these were remote inspections. And so in that period where I said there were no inspections, was there any inspections done in the Derry and Strabane district area, any of the care homes there? Because look, there is a lot of frustration, and people don't feel like the regulatory bodies play enough of a role in actually upholding the private care homes to the standards they should be at. And now there's talk about reforming the system and trade unions gaining access and workers getting higher standards. I mean, I'm not surprised that morale goes up when health service workers goes into these facilities. But that should send a big message about the challenges that the workers are facing in the care homes, and obviously that's then shared by residents and their families. So if you could just elaborate a wee bit about the inspections that were carried out, because I mean I have different statistics, and I've also been told most of them are done remotely, and that if a remote inspection can be done via Zoom or WebEx or Skype, and that's not the same as people on the ground actually hearing the concerns of workers and residents or their families.
Okay. Firstly, I can be absolutely definitive. There were no inspections done using any remote technology during that time, bar one that looked at, in fact, it's in addition to the 6 that took place, which was predominantly looking at documentation in another area. Each of the inspections that took place during that time that I've described to you involved 2 inspectors going out together, sort of full PPE, and into homes where there were concerns raised. Now, I suppose, I mean, there is a bit of a problem if people don't raise concerns with us in that we don't know where to go. So, I mean, the point about staff who are finding that there isn't the correct PPE or they're not properly kitted out. I mean, frankly, in those circumstances, those staff should contact us and make us aware of the concerns, and we will go out. And in fact, the first failure to comply notice we issued during this pandemic was a situation precisely of that nature, where a staff whistleblower emerged, described poor practice with PPE, and we carried out an unannounced inspection and subsequently took enforcement action against the provider and then validated that the practice had changed. I'm afraid I can't give you information today about whether the inspections during that period were in the council area, but I would be happy to check that and write to you, Councillor Harkin, giving you that information.
Okay, thank you very much. And apologies, Councillor Harkin, you did say a follow-up question. It was my mistake that you didn't. It wasn't a sum-up. Sorry about that. Okay, folks, that seems to be everybody that has the questions. Could I, just as Chair of the Health Committee, thank Bob and thank Dermot very, very much for their very detailed and information. And could I also thank the councillors for some very, very relevant questions, and questions that I would have had myself have been answered. I have some concerns, I suppose, around nursing homes not complying or being slow to comply with the various bodies and relaying the information that Councillor or Alderman Devaney touched on. That would be a concern. I would also have concerns around staff being asked to stay in homes during this pandemic. I would have major concerns around that as well. But thank you very much to the gentlemen for coming and giving the presentation. And I think if everybody is agreeing, we're 6:10 here. We will take a 5-minute recess if anybody wants to have a comfort break, and just leave your devices on. And if we could be back in 5 minutes sharp, we'll move into chairman's business. Thank you very much, Bob, and thank you very much, Dermot, for your presentation. Thank you.
Bye-bye.
Thank you.
under men's network. Are you attending this business?
Sorry?
The men's network. Are you attending?
Okay, folks, is everybody back in? Can anybody hear me or everybody hear me?
Chair.
Okay. Right. Sorry, who's that? Who's that speaking?
Hear you, Chair.
Okay. 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 We're moving on to chairman's business. Thank you, folks, for the wee break there. I appreciate it anyway. So we're at item 4, chairman's business. Item 6, sorry. And Councillor Riley had some business. If you want to come in, Councillor Riley.
Yes, Chair. Thanks for letting me in on the chairman's business. It's just to record condolences on behalf of the family of Seamus McAnee, who passed away today. Seamus was a linchpin of the City of Derry Swimming Club and contributed so much to society in that context over his life, including then also being a very important member of the credit union here locally. So I'm asking through your office as chair if the council could write to his family, ask the mayor to do that, just to record condolences to his family at this sad time. Thank you, Chair, for letting me in.
Councillor Riley, and I'm sure that can be facilitated. Is there anybody else that's in a chairman's business? I have some myself. I'll go ahead then if that's okay. I suppose just to thank everybody for your kind words, all the various councillors and aldermen there, and at the start of during the presentation. Thank you very much. Appreciate that. Just to thank Councillor Paul Fleming, the outgoing chair, for his good work the last year and the way he conducted business. He was always very calm and mild, and I admired the way he was able to carry out his business. And also to the deputy chair last year, Deputy Rachel Ferguson. I would also like to congratulate the incoming deputy chair, Councillor Raymond Barr, who I look forward to working with and have worked with already on various matters. And I look forward to working with Councillor Raymond Barr as deputy chair. I have already extended the welcome to the new councillor, Councillor Stephen Edwards, at his first time, and Councillor Sean Mooney. So very welcome to use. Another issue is I have been contacted by an organisation in the town, so you usually know it better than me, maybe called MAN. That is a Men's Action Network, and they would like to maybe do a short presentation to the Health Committee at some stage. And if I could let you toss that around with yourselves for a minute to see if the council or the committee would be willing for that to happen. So it's an organisation called MAN, and it's basically a self-help group for males in the wider area. They were interested in doing a short presentation, and I'm just trying to do the chat group here as I'm talking. Yeah, that's okay. I'll just touch it. And I suppose the other thing is I would just like to mention as chairman's business is the attack on Tullyoscar Orange Hall over the weekend. And I would like to condemn this attack outrightly. Any attack on any community hall that was used for the community needs to be condemned outrightly. And this is in our own area, in the Tullyoscar area, a quiet rural area, and a hall that is used for community. gatherings, and a hall that I have been in myself on several occasions, and I have been in conversation with some of the local people, and obviously they are very angry and hurt that this would happen in this time, and I would like it recorded that I would like to condemn the action on the hall. That's as all the chairman's business. Is there anybody else that has any? I don't think so. So,
Chair,
sorry, go
Councillor
ahead.
McHugh. Councillor McHugh here.
Yes, Rory.
Chair, I would just like to reiterate your comments about the attack on Tully Busker Orange Hall. You're absolutely right. Attacks like that serve absolutely no purpose whatsoever, and I totally concur with your own sentiments on the matter. Thank you, Chair.
Thank you. Thank you very much, Councillor McHugh. And obviously, I think everybody would agree with me on the matter. We're moving into section 7, which is matters arising of the meeting on the 12th of March, pages 1 to 10. Is there anybody has any matters arising from the meeting on March the 12th? I have one, that is Councillor McHugh has one issue. Go ahead, Councillor McHugh, if you're ready.
Thanks again, Chair. Just like to wish you and your deputy all the best in the hot seats for the coming year. It's regarding item HC 63/20, playing pitches and ancillary services needs in rural Strabane, and I would declare an interest as a member of Castledearg St Eugene's Gaelic Club. But officers would be aware that the Gaelic Club in Castledearg approached council, I think originally it was in April 2019, about future need for playing facilities due to work that's going to be carried out on their own training pitch. And at that time, Spamount Playing Fields was identified as a site where they could temporarily use it to facilitate their training. And more recently, they met with council officer, I think it was Ryan Deehan, and there was temporary GA posts were supposed to be supplied in May, but obviously, I would suspect through COVID situation that hasn't been able to materialise. I have had an update on it from Karen, which I very much appreciate. But my query around it is just at whatever time councils playing pitches at Spamount are open to sports clubs such as the GA and Castledearg, will they be able, or will those playing posts, the GA posts, be supplied? I know that Karen had said it could be September before the full remit of facilities, temporary changing rooms and things like that's on site, but surely whatever time the pitch does reopen to the clubs, that those temporary goalposts could be supplied. Thank you, Chair.
Thank you. Thank you, Councillor McHugh, for your comments. And does any one of the officers want to come in to give a response to that?
Yes, Chair, it's Barry here, Barry O'Hagan.
Thank you, Barry.
Through yourself, Chair. Yes, Rory, look, obviously, the crisis we're in, we've been in crisis management mode, and we've had a load of staff furloughed. So, look, we haven't been progressing with any developmental projects, and obviously our facilities are shut. But now, as we move towards recovery mode in line with the executive plan, look, that's something that we will be taking up. I can't give any guarantees in terms of how quick we can get that sorted out in terms of us procuring posts on that, and you'll be aware as well that the lead finance officer has to approve any discretionary spend going forward because of the current financial position of council. So look, that's something we'll follow up on today, and we can give you an update. But what Karen has said is probably realistic in terms of the time frames for opening and getting clubs access to our outdoor pitches and facilities again. So look, we'll follow that up and get you an update when we have some timescales ourselves.
Thank you very much, Barry. And I hope that's satisfactory, Councillor McHugh.
Yeah, thanks, Barry. Thanks, Andy.
Yeah. The next item is item 8, and it is Advice Services 2020 2020-21, and I think it is Barry again. If you're ready, Barry.
Thanks, Chair. Members, the purpose of this report is to seek your approval to extend funding allocations to current advice providers for an additional 9 months to the period of 1st of July 2020, from 1st of July 2020 to the 31st of March 21, based on the allocations for this financial year. Members, we're currently working with Advice NI and Williamson Consulting to develop a robust recording system which addresses council requirements for allocating our funding. Information that we have on statistics shows variable recording up to March 2020, and there's still some outstanding irregularities that we need to sort out. So Advice Pro is now undergoing extensive work and went live at the start of this financial year a couple of months ago. But the recent current COVID crisis has contributed to complicating the process around Advice as well, and the department has introduced operational changes, and no measure exists to record specific queries around COVID at present. So, members, we're seeking your approval to approve the extension of funding allocations to our 3 providers, Dove House, The Resource, and Advice Northwest for the 2021 financial year, and that'll be based on the allocations for last financial year 2019-20.
Okay, thank you, Barry. I see Councillor Farrell was looking to come in on this issue, I believe.
Thanks, Chair, and all the best for the year ahead, and same to Raymond Barr. Happy to propose this item. I think those 3 advice providers need funding certainty in these times of uncertainty, so happy to propose. But I've got a question to Barry. I could have brought it up in the minutes of the March meeting, but my question is specific to the appeals pilot. We agreed in March the funding, but it was dependent on DFC to get back to us in terms of welfare reform, community support, and risk money. Have we got an answer on that? Has it been confirmed?
Go ahead, Barry.
Yourself, Chair. Yes, Rory. There'll be a paper coming to members in July around some of our delegated decisions, and some of them were around advice. So yes, we have got confirmation from DFC on those 2 elements of funding, including the risk money. So we've written out to our providers to let them know that appeals work can continue for the next year. So there'll be a report on that in July. So that has all been confirmed.
Thank you, Barry.
Cheers, Barry. Thanks, Chair.
Thank you. Councillor Logue, would you like to come in?
Yes, thank you, Chair. Thanks, Barry, for that report. Barry, you did kind of touch on the issue that I wanted to talk about, and it was, we all know advice services, they're awarded their money in whether they get bronze, silver or gold standard. Given the pressures that the advice services have had to work under, especially during this very trying time, can I recommend that they won't be any detrimental effect on their standard? Because I know for definite, like for myself, I've had a phone them and get their advice on behalf of constituents far more often than I would normally have had to do so. So I would just like some assurance that they wouldn't be detrimentally impacted by how they've recorded, especially during the emergency months.
Go ahead, Barry, if you're ready.
Chair, through yourself. Look, in terms of the quality of advice, members, regardless of the number of queries and tribunals and that and particular specifics around queries that our providers are involved in, we do still measure the quality of advice. So all of our 3 providers will have experienced the same difficulties, and we know that through our weekly communication with them, that they've all obviously an uptake in their services and an increase in demand. So the quality of advice is still very important regardless of the numbers. So it's not really, Patricia, the quality of the advice that will determine their funding allocations. It will be the numbers in terms of their generalist advice grant, and they're all experiencing that high demand. So we would see probably across the 3 providers the same sort of trend. So that's why our model works well, because you don't really see one provider suffering and the other 2 not. So without having the detailed stats in front of me, I wouldn't be concerned about funding allocations dropping for our 3 existing providers going forward.
Okay, Councillor Farrell, are you happy?
Councillor Logue, yes. Thank you,
Right,
Chair.
Councillor Logue, sorry, yeah.
Yeah.
Yeah, do we need a proposer and seconder? Councillor Farrell, have you already proposed this?
Yeah, I propose it, Andrew.
Yeah. I'll second it.
Councillor Logue has seconded it. That's okay. Good. Item 9, leisure and sports services policy pricing, and that is also Barry.
Chair, members, you'll be aware that our pricing policy and schedule of charges has to go through each year in advance of the new financial year, but because of COVID, we never got it in. So, members, this is going in front of you today for your approval. The purpose of the report is to seek your approval for the leisure and sports services pricing policy and schedule of charges for the 2021 financial year. Members, you previously approved an increase in our climbing wall costs. That's the only change that we actually have from last year's pricing policy. So we're seeking your approval to implement the same pricing policy and schedule of charges for this financial year. Thank you.
Thank you, Barry. And I believe Councillor Logue would like to come in again there. Okay, Councillor.
Yeah.
Go ahead.
Thank you. I think it would be fair to say that our pricing policy is, in comparison to other councils, is very attractive. I would like to propose the pricing policy, but could I just ask Barry a question around the alignment, the pricing policy alignment with Strabane?
Certainly, yeah.
Yourself, Chair. Yeah, our prices from the very first day, the inception of the council, is the prices are the exact same.
Happy enough. Is there anybody else? I see Councillor Logue. Are you happy to propose that? I think you did. Yeah, and did I see Councillor Wark? Graham, do you want to just shout that in? Councillor Wark, to second that?
Thank you, Chair. I'll second that.
Thank you. Thank you. Item 10 is NE Assembly Domestic Abuse Policy and Proceedings Bill, and that is also Barry. Go ahead, Barry.
Chair, members, the purpose of this report is to seek your approval of a draft response to the Northern Ireland Assembly Domestic Abuse and Family Proceedings Bill. Responses were required by the 5th of June, members, so Council has requested the Committee for Justice extend this deadline to enable members to consider the draft response. We have Dermot Harrigan, our PCSP manager, on the line as well if there are any specific questions around it. But in terms of the recommendation, members approve the draft response to the consultation as outlined in Appendix 1.
Thank you, Barry. Is that you wanting to come in, Councillor McHugh?
Yes, thanks, Chair, and thanks to Barry for that report. Chair, I don't intend to delay the meeting any further. I do have some points that I would like maybe to be fed into it. So is it okay for me to forward those comments on to, is it Barry, the correct person?
You want to answer that, Barry?
Yeah, yes, Chair. Through yourself, Chair, if any members have any specifics, comments that they want, they can send them directly through to myself, and I will follow up with our PCSP manager.
It's okay. Happy enough, Councillor McHugh?
Thanks, Chair.
Yeah. Can we have a proposer and seconder for that item?
Propose it,
Chair. I'll second it there, Chair Rachel.
And who proposed it, sorry? Okay. Okay, thank you very much, folks. Item 11 is the nomination of chairperson to the PCSP, and that is Barry again. Thank you.
Thank you, Chair. Members, purpose of the report is to nominate the chairperson to the Derry and Strabane Police and Community Safety Partnership for this year. Members, as the SDLP is the second largest party in council, it's requested that the SDLP nominate one of their sitting PCSP members to take the position of chair for a period of 12 months, as required under the Justice Act for Northern Ireland.
Okay, that's okay. Councillor Farrell, I think, is the first to come in. Councillor Farrell.
Yeah, thanks, Chair. On behalf of the SDLP, I'd like to nominate Councillor Martin Riley for that position. Thank you.
Okay. Does that need to be seconded?
Chair, can I formally second the proposal?
Okay.
And accept it. But also, can I make another proposal just on the same item? Is just to change the membership of the SDLP group on the PCSP to swap Brian Tierney out of the PCSP now that he's mayor, and to replace him with Councillor Jason Barr, please. Thank you.
Okay, we'll get that noted. That's okay. Did I see where Councillor Farrell, Councillor Duffy, did you want to come in on that?
Yes, please, Chair. I just want to make a change as well. So I'll start off by congratulating Councillor Riley, but I just want to make a change. Could I change Councillor Rory McHugh to Councillor Michaela Boyle? Thank you.
Okay. So some minor changes to the policing board there, and congratulations to Councillor Riley on his appointment. Moving on, everybody happy enough to move on to point 12? Yeah,
And there.
Sorry?
I had my hand there.
Who's that? Sorry, come on ahead.
Councillor Harkin.
Sorry, Councillor Harkin, come on ahead.
Yeah, thanks, Chair. Yeah, so this is a policing board issue, and I'm sure everybody's aware of what happened in Derry and Belfast on Saturday. And I think anybody that has voted themselves onto this body should be taking this issue up. There was 57 people in Derry given fines and people given possible prosecutions because of the Black Lives Matter rally. And I'm sure people have seen now Amnesty International's comments, the Committee for the Administration of Justice here in the North condemning what's happened. I'm sure people have seen the last minute rush in Stormont on Friday night to pass legislation to carry out these actions. So I think that the Black and minority communities in Derry are united behind three demands, and that is that there needs to be a review of what happened in Derry and Belfast, that there needs to be a public apology to the Black community in this city, and that all the fines and all the threats of prosecutions have to be dropped. And there's been an attempt already to try and sweep this under the carpet, and that is not going to happen. And this council needs to make clear that we do not think that what happened in Derry was in any way proportionate, as the Justice Minister has tried to claim, and that all our councillors should be saying that the harassment of our Black community should be condemned, and that the fines and the prosecutions should be dropped. So I would like to see the councillors in this committee, especially the councillors who put themselves on this board, join me in agreeing with Amnesty International and the Committee for the Administration of Justice and the Black and minority communities, agreeing that with them that what happened in Derry and Strabane should be condemned, it should never happen again, and that the threats prosecution should be withdrawn and the fines should be immediately withdrawn as well.
Thank you. Thank you, Councillor Harkin, for your comments, and I think Councillor Donnelly would like also to come in.
Chair, thank you very much. I'm not a member of this committee, but thanks for letting me in, and congratulations on your appointment. Chair, it's just I think my views on these boards are pretty well known. I did put a proposal that we withdraw funding to them, because I see them as virtually useless, a waste of time and a waste of money. And you know, there has been a recent in Craigan where 2 children were beaten by members of the TSG. One of these children has special needs, and in the aftermath of that, there hasn't been a word uttered by the SDLP. So the appointment of Martin Riley to this post will just confirm, won't give any type of hope to people in the nationalist community, because they're very selective in what they see or what they speak out against. And I'd also like to echo the sentiments of Councillor Harkin there regarding the operation carried out by the PSNI at last Saturday's protest. Thank you.
Thank you for your comments, Councillor Donnelly. Councillor Riley has a comment, or wants to come in, sorry. Go on ahead, Martin.
It looks like Councillor Riley has lost connection there.
Okay, we can come back to him. Councillor Duffy is next in line. If you'd like to come in, Councillor Duffy.
Thank you, Chair, for allowing me in. Yes, I'm also a member of the PCSP, and we actually did have a meeting yesterday. And at that meeting, we did discuss the Black Lives Matter protest. It was raised by myself under Chairperson's business. It was also raised from the floor by my party colleague, Paul Fleming. So it was very much discussed yesterday, and it was very much discussed in the vein that we felt that the position of the police wasn't proportionate to the protest. So it very much was discussed, and we as a party have also met privately with the police to discuss it, because we have serious concerns around it as well. Thank you.
Thank you for your comments, Councillor Duffy. Alderman Devaney.
Thank you, Chair, for allowing me in on this issue. And I know it's a very, very sensitive issue, and it reverts back to the murder in America. And I have to say, Mr. Chairman, in light, I have always had the view that I do believe in protest. Protest is right in the right manner. But I also believe that when protests become violent, and the scenes that we have seen over this last number of days since the incident in America. And I have to say, when we look back at the situation, we would agree as a party that this shouldn't have happened. It was totally, totally wrong. But we would totally condemn the violence in and around the protests that have taken across the UK and across Northern Ireland. And I have to say, yes, it was raised yesterday at the PCSP meeting, and I'm a member of that. And the police gave a fairly good account for themselves yesterday. And I will say, Mr. Chairman, that I believe we have no right in interfering in the issue of fines. That is down to the judicial system, an issue to do with the police and the judicial system. So we will not be supporting this this proposal coming forward.
Thank you, Alderman Devaney. Did I see Councillor Riley back in there again? Do you want to come in, Councillor Riley, if you're connected?
Yeah, thanks, Chair. Hope you can hear me. I got logged out at the start of Councillor Donnelly's comment, so I'm not sure what he said after I got logged out. But I had heard all of what Councillor Harkin had said, and can I agree with the comments of Councillor Harkin, because I was able to hear them in full. This issue was raised by my party leader with the Chief Constable on Monday. The local SDLP Derry-Strabane team had a conversation with the PSNI well on Monday, and it came up yesterday at the PCSP meeting as well. Now, in advance of the nomination that has just taken place for me to chair the PCSP for the year ahead, I also have had a conversation with the PCSP manager, asking him to arrange a conversation that I can have with senior police officers about how we can move forward involving the Black and ethnic minority community in our city and district with the policing community partnership in the year ahead. So they're the comments I have to make, Chair. except that I got logged out, so I don't know what others said, and if I have repeated what others have said, then I apologise for the time that may have been lost. Thank you.
Thank you, Councillor Riley. Councillor Harkin, is that a proposal you're making, or where are we?
Well, yeah, I would like the committee to agree that one, that what happened on Saturday was not proportionate. That two, that it was an example of the institutional racism that people in the Black Lives Matter movement have been protesting. And three, that we as a committee agree that all fines and all threats of prosecutions should be immediately dropped. And I think we should agree. It sounds to me like there is majority support for that. But that I wanted to come back on what Councillor Alderman Devaney said about violence. That there hasn't been any violence. There was no violence in Derry and Belfast. So the talk about violence and the protests that is inaccurate. What we had was a policing operation that actually disrupted social distancing, harassed mostly people of colour who were speaking out about racism. And for people to say that they oppose racism and oppose the right to defend the right to protest, this was an example in our city of people's right to protest being trampled upon. And it was also an example of the very, very racism that we see in the United States and in the rest of Britain. And this is why Black people and people in ethnic communities are united right now about what happened on Saturday. And it's why they're demanding answers from those who green-lighted this and then from the police who actually carried it out. So I'm glad to hear that political parties are now demanding that the fines be dropped and that the threats of prosecutions be dropped, but there also needs to be an apology to the Black communities and the Black organisers and the people of colour who led these protests and who in fact organised them even when there was calls for them not to go ahead.
Thank you, Councillor Harkin, for your comments. Alderman Devaney, do you want to come in?
Thank you, Chairman, for allowing me back in. And I just want to remind Councillor Harkin that the message went out on Friday evening from the Unity of Purpose meeting. This is a grouping that maybe Mr. Harkin's party didn't even know existed, that has been in here for quite a period of time. And that is the leadership of a number of all the parties in the city and a united front with the business community that called for this protest to be stopped or postponed on Saturday. And I think Mr. Harkin should really understand that, you know, we're in a very, very unusual circumstances here with the issue of COVID-19. And, you know, we all talk about protecting one another and protection. You know, every one of us in society at the moment has a duty of care to protect each other. And I mean, I carry that out in trying to protect my family. And if I'm out and about, I try to protect those people in and around me, whether that's around the shops or if I have to go to the shops. But I do believe, I think this is very, very reckless.
Thank you, Alderman Devaney. Alderman Warwick, you were looking to come in.
Thank you, Chair. Obviously, as a member too of the PCSP board, we talked on this along with me, fellow Alderman Devaney there, and I totally echo the words Alderman Devaney. But the fact is, as Maurice said, here, this should not have happened on Saturday. Everybody has the right to protest, but hundreds of people shouldn't come on the streets, especially in the city when everybody's doing so well, when loads of people can't even attend funerals of friends or loved ones. Families can't visit each other, and then you see hundreds of people gathered on the Guildhall to protest. It shouldn't happen. It could have happened in other ways. Obviously, the Unity of Purpose grouping, which I understand Sean Harkin would be aware about, a more or less a plea not to gather people there, because you're risking the healthcare workers, you're risking the public of the city and district's lives. Thank you, Chair.
Thank you, Alderman Warwick. Councillor Ferguson, would you like to come in?
Thank you, Chair. Obviously, there was a question over Naomi Long's comments on this being proportionate. obviously Naomi's going off the information that she's been given, and she is not there to basically scrutinise the place. She has said to go ahead and go to the ombudsman, the police ombudsman. I, again, fully support the Black Lives Movement and the right to protest, and obviously understand that during the pandemic we need to think of more innovative ways to do that. I fully understand the questions that have been raised around the protest on Saturday in comparison to other protests within the district. So I am not in the place where I am going to make a comment on either at this moment in time, because I would rather take the time to, I've reached out to Lillian, I've reached out to the Northwest Migrants Forum, and we're facilitating a chat, and I'm happy to do the same with the PFNI, to ask those questions too. So unfortunately today I won't be supporting Councillor Harkin's proposal, because I just think we're not in the place. We do need a review of what happened, and it to be clear and transparent for everybody to see. Thank you.
Thank you, Councillor Ferguson, for your comments. Obviously, folks, we have differences of opinions. Can I get some officer advice on where else to take this? Do we bring it back to full council, or can I get possibly Karen to come and give some advice on this? Thank you.
Chair, members, obviously the matter is on the floor. Councillor Harkin has placed a proposal. I suppose we need to clarify, is there a seconder for that proposal? Ask you to maybe take that step first.
Okay, thank you very much, Karen. Is there a seconder for the proposal, Councillor Harkin's proposal? I don't hear anybody seconding the proposal.
Chair, it's Martin right here, Chair. As you know, I got disconnected. When I was connected, Councillor Harkin spoke, but he didn't make a proposal. So maybe he made it when I was disconnected, I'm not sure. Has the proposal been put in a written form in the chat box, or perhaps he made it and I missed it? So I'm not sure if about seconding it, if I haven't heard the full proposal, please.
No, there is no proposal in the chat box that I see. Yeah, you wouldn't mind clarifying, Councillor Harkin, exactly where you want to go?
Well, I'll simplify it, because if a seconder is willing to do that, there's 2 points. That the police operation at the Derry and Strabane Black Lives Matter protest was not proportionate in any way. That all fines and threats of prosecution should be immediately rescinded.
Okay.
Chair, I'm just to jump in, Chair. I'm happy to second what Councillor Harkin has just proposed. It matches what our own MLA Mark Hayes-Strachan had raised in the Assembly as well. Thank you.
Folks, so we have a proposer and a seconder, and Councillor Harkin has clarified his proposal. So we are moving into a vote. Okay, folks.
Members, then for the record, can I record the votes? So Alderman Devaney.
Against.
Alderman McCain.
Against.
Alderman Wark. Alderman Wark. We'll come back. Councillor Barr. Councillor Barr, I think, indicated he needed to leave at 6. Councillor Burke is absent. Councillor Duffy.
Could I abstain and propose an amendment?
Okay.
Propose an amendment now.
You can't really propose an amendment when we're voting on the actual motion.
No.
I actually thought that as soon as I spoke. 4.
So Councillor Duffy 4. Councillor Edwards.
4, Karen.
Councillor Farrell.
4, Karen.
Councillor Ferguson.
Against.
Councillor Harkin.
4.
Councillor Logue.
4.
Councillor McHugh,
For Karen.
Councillor Mooney,
For, thank you.
and Councillor Riley. And we'll just give us a second to do the tot. Hang on.
Yeah, forward, Karen, thank you.
Chair, did Karen get mine there? It was against.
Yeah, yes, you got it. Alderman Wark. So that motion is 8 for and 4 against. So that motion is carried. Okay, so Councillor Harkin's motion is carried. Are we happy to move on to item 12? Coronavirus. Or do you want to come back in again? Sorry, Councillor Harkin, before we move on.
Chair, no.
Okay, thank you, Councillor Harkin. We're moving on to item 12, coronavirus business restrictions and closures, and that is Seamus.
Thank you, Chair. Members, the report provides an update on the Northern designate councils as the enforcement authority for the purpose of the business restrictions and closure element of the health protection regs. The Department of Health published the health protection regulations in March in order to help protect health from the threat posed by COVID-19. The regulations continue to be amended to reflect the Northern Ireland Executive's recovery plan, resulting in some categories of business being permitted to open with or without restrictions. The enforcement protocol attached to the committee members outlined a graduated enforcement approach, which authorised officers will take to ensure compliance with the regulations. To date, compliance has been achieved through the provision of advice and guidance, though fixed penalty notices and prohibition notices may be issued where this is deemed necessary. And members, you're asked to note the new enforcement role which councils are to undertake and approve the enforcement protocol.
Okay, thank you very much, Seamus. And I don't think there's anybody in the chat box to come in. Am I correct on that? So if there's nobody in the chat box to come in, are we happy to move on to proposer and seconder?
So proposed, Chairs Morris.
Okay.
So seconded, Sean here, Chair.
Sean Mooney.
Yeah.
Thank you, and thank you, Alderman Devaney and Councillor Mooney. Section 13 is the appointment of additional public analyst, and that is Seamus.
Members, the purpose of the report is to seek approval to appoint an additional public analyst to carry out examinations and analysis of food samples on behalf. The report outlines the current list of public analysts appointed and employed by Public Analyst Scientific Services Limited to analyse food on behalf of the 11 councils, and as there are no financial or other implications with this appointment, members are asked to.
So proposed,
Okay.
Chair, from Morris.
Morris, Alderman Devaney, thank you. And the seconder?
Seconded, Alderman Wark.
Alderman Wark. Okay. Now we're moving into open for information, item 14 to item 18. I'm happy to move through them. If anybody wants to comment on any of the 5 items, can they please indicate? Otherwise, we will move on to confidential for discussion. Did I see Alderman Devaney looking to come in on item 16?
Chair.
Follow 16.
No,
sorry.
No, I want to come on item 15, Chair.
All right.
Okay.
One above you.
Well, we'll just take it the way it's coming to us. Sure.
That's okay.
Alderman Devaney wants to come in on 15, and we'll go to next to 16. Sure, is that okay?
Yep. Thank you, Chair, for allowing me in. I want to just welcome the item number 15 coming forward here and welcome the report. I think it's timely and about clean neighbourhoods. But Mr. Chairman, I want to raise an issue, and this is the 3rd time I've raised this issue, and it's relation to dogs. It's in relation to dog fouling. And as we know, we've been in through the COVID-19, and many of us have got increased complaints about dog fowl on streets. We've heard about the Peace Bridge and other areas. But Mr. Chairman, I have asked now for the third time. I wanted to find out very clearly now, when I asked the last time, I asked for the previous 5 years, but now we have another year up, we're into 6 years, in relation to how many fines have been issued and how many fines have been paid or taken through the courts. And I think I'm nearly due that update now anytime.
Thank you. Is there an officer who would like to come in on that?
Yes, Chair, it's Seamus here.
Thank you.
You're happy to, I'll answer that query. Yes, Alderman Devaney, by all means, there is a report due to come in to the July committee, but I can give you a quick update in terms of fixed penalties. For the last 2 years, I don't have the figures for the 5 years, but for 2018-19, there was 5 fixed penalties issued for fouling and 38 fixed penalties issued for straying. And there is a consensus that a stray dog results in fouling. Also in 2019-2020, there was 2 fixed penalties issued for fouling and 27 issued for straying. And I can advise members that we're proposing to authorise additional members of council staff to issue fixed penalties in the future. And we've developed an app where dog wardens can record all dog control patrols to investigate dog fouling complaints. Further information at future committees.
Thank you, Seamus. And if Councillor Farrell doesn't mind, we'll just, but Councillor Logan's looking to speak on the same item, and the fact that we're on that, I think we'll just take Councillor Logan and then we'll move on then. Thank you.
Thank you, Chair, and Seamus, thanks for that too, but you kind of touched on what I was going to ask, Seamus, and it was on how many employees within council can issue a fixed penalty notice and what is being proposed for the future.
You, Chair, currently my understanding is there's approximately 8 or 9 council officers who are authorised to issue fixed penalties for dog fouling, and through the dog order consultation process, the internal working group will consider whether additional staff can be authorised, and again an update will be provided to members at a later date.
Thank you very much, Seamus. And we'll move on to item 16 and Councillor Farrell, if that's okay. Go ahead, Rory.
Thanks, Chair. So on the affordable warmth, again, this could have been brought up in the minutes of the March meeting. At the March meeting, I had asked, was there any update on changes to the scheme that would disregard PIP, DLA or attendance allowance income? So I'd be grateful of an update from Seamus on that. And just one further query in terms of affordable warmth. Last year we had an affordable warmth working group that looked at the impact of the scheme, and it wasn't included in the internal bodies that we allocated on Monday. So I'd like to know if that group has been wound up or was that an oversight?
Go ahead, Seamus.
Through you, Chair, yeah, I do appreciate back in March there was a committee report providing an update on the level of funding for the affordable warmth scheme, which was a positive story in terms of the increase in funding and potentially to continue to 2024, as it's a flagship project for DFC in terms of fuel poverty. Unfortunately, again, this report that has been brought to committee at this meeting outlines that actually has been reduced due to COVID-19 restrictions, and it's not possible to deliver the scheme due to the restrictions in carrying out home visits, and the Housing Executive can only accept processing emergency referrals. So what we do hope to happen maybe in the near future is that we can continue to get the referrals processed as quick as we can when restrictions are relaxed, and we have members of staff there to help facilitate that. In terms of Councillor Farrell, your query in terms of the working group, it was a task and finish working group, and we felt that we had achieved what we set out to deliver. And again, the funding increase was a positive outcome for that. By all means, if members would like to reconvene that working group, we can facilitate that.
Thank you, Seamus. Yeah, I'm happy with the response. Councillor Farrell.
Thanks, Chair, and thanks, Seamus. Well,
okay.
Things have changed, so we got the letter in the March committee that committed to 95 grand a quarter, and now that's not the case. So it's very much a live issue in terms of DFC support to this council. If COVID hadn't happened, maybe we were okay, but there's still issues regarding affordable warmth. And I, for one, think that the working group is valuable. It gave us great insight on the scheme and how we can support people to get out of fuel poverty. So I would propose that once the restrictions are lifted, once DFC provide a proper level of funding for the scheme, that we reconvene the working group.
Okay, Councillor Farrell, you've heard a proposal, folks. Is there a seconder for that proposal?
Chair, can I just come in formally to second Councillor Farrell's proposal there? I think it's equally valid to point out that during the COVID lockdown, so many people are staying in their home. So we need to make sure that their home is warm. So therefore, happy to second the proposal. I think it's vital that we keep an eye on this important issue. Thank you. But with that in mind, Chair, as it was a working group and it was one from each party, simultaneously then happy to nominate Councillor Farrell to the working group when it is reconvened. Thank you.
Thank you, Councillor Riley. So you've heard the proposal and seconder. Is there anybody opposed to this? And if there's nobody opposed to it, obviously we'll move on and let the group leaders, whoever wants to attend the working group. Is there anybody opposed? I'm hearing no dissenting voices, so we'll take it that that's passed. Item 17 is correspondence.
Chair, just before you move on, I wanted to come back in again on that item 15. Maybe I sent it on the wee chat thing.
Must have missed it. So I must have missed it. Go ahead,
no, thank you, Chair, for allowing me in. And I want to go back to item 15 again. And the figures that I got, how many fines have been issued for dog filing, it was a wee bit fuzzy, the sound. So could I ask Seamus maybe to regurgitate that again? I think it was 5 and 2. Was it 5 for dog filing, 2 for straying?
Yes, Alderman Devaney, for 2018-2019, there was 5 for fouling and 38 for straying.
5 for fouling and 38 for straying.
In 2019-2020, 2 for fouling and 27 for straying.
27 for straying. Just in response to that there, I want to say, I had asked for the last 5 years, and maybe that could come forward to the July meeting. I'm disappointed with the numbers because in light of this serious issue that has been ongoing for a decade or more, and despite all the initiatives that we as a council have thrown at that there, whether it's dog wardens or whether it's signage or information going out via media and stuff like that there, I'm disappointed in the numbers, and I think that's something that we need to be seriously looking at as a committee. Thank you, Chair, for allowing me back in again.
Thank you for your comments, Alderman Devaney. So if there's no further comments on item 17 or 18, we'll move into confidential for discussion. Do we have a proposer for confidential on discussion?
Chair. I'll propose Morris.
Okay. Thank you, Alderman Devaney. Have we a seconder?
Councillor Farrell.
Thank you, Councillor. So item 19 as matters arising out of the confidential health and community meeting, pages 189 to 192. Is there any matters arising?